Well, good morning, everyone. I'd like to call us to order. This is the 25th meeting of the Emergency Preparedness and Protective Services Committee of this term of council. A good Monday morning to everyone. Today we have a full agenda this morning with 3 presentations. First presentation today will be the annual report from the Ottawa Paramedic Services 2025. The report provides an overview of operational updates, performance trends, and key achievements from the past year. It also reflects the measurable results of Council's strategic investments in the Ottawa Paramedic Service, including the approval of the 2024-2026 investment plan, which has supported the addition of 141 new positions in enhanced deployment capacity and the continued evolution of community-based care models. Second presentation today will be regarding the comprehensive review and the reenactment of the city's licensing bylaw. As directed by Council through the bylaw review work plan, staff have undertaken a detailed review of the framework governing licensed business in Ottawa. The bylaw plays an important role in supporting public safety, consumer protection, property protection, and the nuisance control, and staff are here today to present the results of that review with their recommendations. And last but not least, our final presentation this morning will be on the 2025 annual 911 report. As Ottawa's 911 authority, the Public Safety Service oversees both the technical delivery of the 911 system through Bell Canada and operational call intake through the Ottawa Police Service. The report highlights service performance, updates on the inter-city 911 call transfers, and progress toward the implementation of next generation 911. So we have 3 valuable reports that we'll get to in just a minute. First, I will ask our committee coordinator to conduct a roll call, please.
Councillor
Here.
Bradley. Conseiller Desroches.
Here.
Councillor Dudas. Councillor Devine.
Here.
Councillor Hubley. Councillor Johnson.
Here.
Councillor
Present.
Kelly. Councillor Luloff. Conseillère
Allô.
Plante. Councillor Skalski.
Here.
Vice Chair Hill.
Present.
Chair Brockington.
Here.
Mr. Chair, we have quorum.
Excellent. Thank you very much. The City of Ottawa, as we know, is located on unceded territory of the Algonquin and Anishinaabe First Nations people. They have been inhabitants and stewards of these lands for millennia, and we honor and recognize all First Nations peoples, Métis, and Inuit. Are there any declarations of interest this morning? Seeing none. Item 3 in our agenda is the confirmation of minutes. This was from our meeting 24 on May 28th, 2026. I assume everyone's had a chance to review the minutes. Are the minutes of the May 28th, 2026 meeting confirmed? Great, thank you very much. Item 4.1, status update, Emergency Preparedness Protective Services Committee inquiries and motions for the period ending June 4th, 2026. The motion is that we receive this report for information. Is this received? Great, thank you. So item 5 is the Ottawa Paramedic Services 2025 annual report. We have no speakers nor any written submissions for this item. There is a staff presentation, so we'll get to that in 1 second. Item 5.2 is the licensing bylaw review and reenactment. We have not only a presentation, but we have some delegations before us today. And we have some motions from colleagues, which we'll read again momentarily. So we'll hold that item. And the next item, 5.3, is the 911 2025 annual report. It's my understanding we have no speakers and we have not received any written submissions for this. However, there will be a staff presentation. So we'll hold this matter and we'll deal with the other business once we complete those 3 reports. So we'll go back now to item 5.1, which is the Ottawa Paramedic Services 2025 annual report. And I guess we'll start off with introductions. I'll yield first to our general manager, Mr. Perreault, please. Oh, you want to say it? Go straight to our chief. So Chief Poirier. Good morning. Go ahead, sir.
Bonjour, Monsieur le Président. Aujourd'hui,
Hello,
je suis
everyone.
très fier de nos résultats.
I'm very
de
proud of
notre
the result
rapport
we've
et
achieved.
de notre équipe.
I'm very
Ça,
happy
c'est
to
la
present
raison
it to
que
you
nous sommes
today.
tous ici aujourd'hui. Today, I'm very proud of the Ottawa Paramedic Service results, this report, and the team that actually pulled us together. So just in terms of introduction, beside me, Deputy Chief Greg Furlong, Deputy Chief Menno Laverne, and Deputy Chief Jennifer Alexander, and in the crowd, Deputy Chief Peter Kelly. This report highlights the good work and the great service that we provide to our community. So next slide. Going back 4 years, our service was not great. We had a report that went to committee and council, the investment report, and we followed through on that report. We've added 141 staff over the last 4 years with a focus on the fact that we had to improve response times and improve our service to our community, all during a period at which our call volume, our responses increased significantly as well. We've done good work. Next slide, please. I'll turn it over to Greg just to talk about some of our metrics.
Thank you, Chief. Good morning. Through the council investment strategy over the last 4 years, we've seen a significant reduction in the level 0 occurrences, culminating to a total of 866 minutes in 2025, which equates to a 99% improvement in level 0. As we do continue to improve, our position is that there should never be a time where there's no paramedics available to respond to calls in the community, and we continue to develop strategies to help reduce level 0 events. Next slide, please. Over the last 4 years, the paramedic service has continued to work with our hospital partners at reducing offload delay, which is defined as the amount of time paramedics spend in the hospital waiting to transfer care to emergency department staff. The performance target is 30 minutes at the 90th percentile. We've seen significant improvements over the last 4 years. Specifically, the MOL4 has reduced offload delay from 224 minutes to 62 minutes, a substantial improvement. We still have work to do to build towards the 30 minutes performance target. Next slide, please. Our response time performance, council sets the citywide response time performance target for the paramedic service. The Ottawa Paramedic Service has met our performance targets in 5 out of the 6 categories. We continue to work on strategies to improve response time to the most critically ill patients within our community. Next slide, please. We wanted to highlight a few of the operational improvements that we've instituted over the last 4 years. The paramedic service continues to innovate with new solutions to assist the growing call demand. In urban areas, to assist with challenges related to the opiate crisis, we have deployed single response paramedics to Lower Town, including the Bywood Market in Sandy Hill, as well as the Centertown area. To assist with the City of Ottawa's vast geography, we have added resources to rural communities such as Richmond, Metcalfe, and Kinburn to help continue to improve our service delivery. Next slide, please.
Thank you, Greg. Accredited Center of Excellence designation is a significant achievement for the Ottawa Paramedic Service, making us one of the only 3 centers in the province to receive it. It means we are delivering safe, consistent, high-quality care starting at the 911 call, aligned with internationally recognized best practices. It also optimizes how we use our resources and help ensure availability for life-threatening emergencies, improving overall system performance. Achieving this accreditation will allow us to enable remote healthcare opportunities that improve how we connect patient to care, reduce unnecessary hospital visits, and ensure the right care at the right time with the right resources. Last week, we had the privilege of welcoming the mayor to our communication center to celebrate our amazing staff on this incredible achievement. Next slide, please. Le soutien au bien-être de notre personnel ne
We are
repose pas
supporting
sur
the
un seul
well-being of our
programme, mais
personnel.
fait
We don't have
partie
only one
intégrante
program, but it
de
is
notre
also part
culture.
of our
Grâce à
culture.
notre stratégie de mieux-être, nous
We have a
adoptons
strategy
une
in
approche
place.
globale de la
We
santé
have an holistic
mentale
approach
et de la
of
façon dont ces
for
différentes
mental health
composantes s'articulent au sein du
and how we
service.
use the different
Cela comprend
components.
notre programme
This
de soutien
includes
par les pairs,
a
en place depuis plus d'une
peer-to-peer support
décennie, qui
program.
demeure un élément clé
And
de
this is
l'entraide
a
entre les membres
key
du
element
personnel.
of
Dans le
help
cadre
between
du plan
peers.
d'investissement approuvé, nous
Through
avons
the investment
également
plan that was
acquis trois
approved,
cliniciennes
we now
spécialisées en
have
santé
3
mentale, ce
specialists
qui nous
in
permet
mental health.
d'approfondir notre
This
compréhension
allows
des
us
besoins du
to
personnel
better
et
understand
de
the needs of
proposer
our
une
personnel
combinaison de mesures
and
de
to
soutien
offer different
adaptées
measures
allant de la
well
thérapie
adapted,
à la nutrition et au
going
bien-être.
from
Dans
treatment
l'ensemble,
to
il s'agit de
nutrition
bâtir
support.
un environnement où tout
We
le
want to put in
personnel
place
se
an
sent
environment
soutenu
where
et
everyone
peut
feels
continuer à
supported
accomplir l'important
and that they're
travail
able
qui
to
leur est
continue
confié.
their very important
Supporting
work.
the well-being of our people is not a single program. It's a core part of our culture. Next slide.
Thank you, Minnow. Community paramedics deliver a range of innovative programs in partnership with healthcare and community organizations to improve access to care and support patients staying safely at home. In partnership with Montfort Hospital, community paramedics remotely monitor post-surgical patients after their discharge from hospital with the ability to monitor and treat many post-surgical complications. In partnership with the Queensway Carleton Hospital and Montfort Hospital, community paramedics conduct home visits for patients with complex medical needs through our enhanced remote care monitoring program. This program keeps patients healthy and safe in their homes. In partnership with Ottawa Community Housing, community paramedics hold regular wellness clinics at several locations in the city to support older adults with the aim to improve overall health care. Last year, community paramedics partnered with the Ottawa Nurse Practitioner-led clinic in Vanier. This partnership enhances access to primary care through routine, same-day, and urgent care appointments and provides health education focused on chronic disease management. Our palliative care program, paramedics treat palliative care patients in their home, avoiding transport to hospital, and coordinate follow-up care with the patient's primary palliative care team. As part of our overall programming, community paramedics support vulnerable individuals to remain safe and healthy in their homes, delaying their entry into long-term care and preventing emergency department visits. In 2025, community paramedics cared for over 12,000 patients in the community. All of these initiatives are about caring for individuals in our community, reducing emergency department visits, and ensuring we are providing compassionate care in the right place and at the right time. Next slide, please. The Ottawa Paramedic Service continues to pursue leading-edge initiatives to provide care to the community. It's been over 20 years since the Royal Ottawa Hospital has accepted patients from the paramedic service. We are currently working with the Royal Ottawa to develop a pathway to transport mental health patients to their urgent care clinic, further reducing impacts on hospital emergency departments. In collaboration with the Homelessness and Addiction Recovery Treatment Heart Hubs through Somerset West Community Health Centre and Pinecrest Queensway Community Health Centre, we are developing a pathway to safely transport patients with mental health and substance use needs to these hubs. And as mentioned on an earlier slide on operational improvements, we continue to look at ways of adding paramedic resources to continue to enhance rural service delivery. Next slide.
Thank you, Jennifer. It's kind of a change in path, but I just wanted to highlight our West Deployment Facility. The Ottawa Paramedic Service has been on Don Reed Drive for 20 plus years, and over the last several years, we've recognized the need for a new facility. Through the support through Council, in February of this year, we had approval to move forward with a public-private partnership by which we would follow the procedures, guidelines, and policies of that policy. Just recently, at the beginning of June, we went back to Committee and Council for approval of the procurement strategy. We look forward this fall to a request for qualification and then a request for proposal to continue to move this program forward. We've secured land in Barrhaven so that we'll continue to be able to provide our service delivery and improve our service delivery to West Ottawa and to South Ottawa. So we're very much excited about this project. We look forward to reporting back to council again as the project progresses. Next slide, please. In summation, it's sometimes I think it's important to have the first person narrative. I'm incredibly proud of the service we provide to our community. And we receive over 300 compliments a year specific to the patient care that we provide in the community. So I'd just like to have the opportunity to recount a couple of those. And I'll start, I think, with Manon.
Thank you, Chief. Sous la bannière de compétences et d'excellence clinique, ce premier complément ne parvient le professionnel de la santé qui est présent lors de
highlight the service of one of our paramedics. The paramedics did everything to intervene. Every type of intervention that would be needed at the emergency room were given on site, and that patient was able to survive. The level of care given reflect the skills of our paramedics.
Thank you, Manon. On clinical competence, on compassion and understanding. On June 2nd, 2025, paramedics attended to a medical emergency, and the patient later expressed their thanks and dedication for the delivery of quality care. To quote the patient, "I always sent the paramedics away, refusing transport to hospital. The issue was that once I would fall ill, my symptoms would fade quickly. I'd be embarrassed, and I would feel normal within a few minutes. I still remember this very clearly. They looked at me straight in the eyes and made it abundantly clear that I'm having a medical emergency. This was serious, and I absolutely needed to go to the hospital. I believed them and went straight to the hospital. I was taken to the general, where my diagnosis was quick, and I had surgery at the Civic on June 4th. The paramedics saved my life that day."
Thank you, Greg. And for the medication error recognition, a paramedic from our community paramedic program was caring for a patient with a long, complex medical history and noted that the patient had been feeling increasingly unwell. The paramedic conducted a full assessment and found that a new medication could be contributing to the patient's current symptoms. After consultation with the patient's specialist, the diagnosis was confirmed and the medication was immediately stopped. The paramedic ultimately saved her life.
Thank you, Jennifer. And just in summation, it's been a good year for the Ottawa Paramedic Service. Our community has responded in terms of the compliments that we receive. There's a recognition that healthcare remains in crisis, and our service is willing to do what's necessary to keep people safe, to provide the appropriate care, and on the occasion, save a life. We're prepared to take questions. Thank you, Chair.
Thank you, Chief and Deputy Chiefs, for your presentation today. And I do want to thank all members of the Ottawa Paramedic Service for their service to the people of Ottawa. We very much appreciate not just our paramedics, but the entire team who contribute to the service that's provided 365 days a year, 24 hours a day. And I appreciated you reading some of the comments from patients who have received care, because it further illustrates the appreciation that the people of Ottawa have, including council, for the Ottawa Paramedic Service. So thank you very much. I will say, as someone who's quite familiar with statistics, having worked at StatsCan for many years, to see level zeros drop by 99% is nothing but outstanding. In a real problem that has plagued us for way too long, and to finally see the metrics move significantly like this means a significant better care and service to the people of Ottawa. To see that is fantastic. So congratulations. And also very much appreciate seeing movement on the offload delays at every single hospital. That was also a significant challenge that we've had, and we've talked about this in this very committee for a very long time. I'm sure my colleagues will talk about response teams overall, reasonable, obviously some improvements to be made, and I'm sure there'll be questions in that regard. So I'll yield the floor now to my colleagues. There are a number of hands that are up, and Councillor Luloff, we will begin with yourself. Go ahead.
Thank you, Chair. Listen, I want to begin by acknowledging the incredible work of the Ottawa Paramedic Service members. Every day, you enter situations that most people spend their lives hoping never to encounter. You respond to trauma, loss, addiction, violence, human suffering on a scale that few of us can fully appreciate. Thank you. When we talk about service levels, response time, staffing, and operational performance, these are all very important metrics. And behind every single one of those metrics is a human being carrying the weight of what they've seen and experienced. But before I turn specifically to mental health, which I know the chief is probably anticipating, I do want to acknowledge the significant progress that has been made on the level 0 issue, as the chair mentioned. I've asked questions about level 0 every year in the last 7 years because I know how important ambulance availability is to residents and to frontline paramedics. I think that it's important to recognize that we've seen real progress here. I want to thank you for your leadership and staff for their continued effort in that regard. And I'd encourage the service to keep pushing for further improvements, particularly in rural areas and in the East End, where communities such as Cumberland Village continue to benefit from enhanced coverage and response capacity. I'd also encourage the service to continue finding opportunities to communicate the outstanding work being done throughout the year. Ottawa residents often see paramedics on some of the worst days imaginable, but they do not always see the professionalism, compassion, training, innovation, and community engagement that occur every single day behind the scenes. Sharing those successes not only improves public awareness and confidence, but can also prove to be an important source of pride and morale for the dedicated professionals who serve our community. Mental health is not a secondary issue for first responders. It's foundational to organizational health, operational readiness, retention, and ultimately to public safety. As someone who's spoken very openly about my own experiences with mental health, I know that seeking help can be difficult. And I also know that early intervention, peer support in some cases, and access to professional care can change lives. I was encouraged to read about the work being done to support members' mental health. I want to thank the leadership team and peer support teams, clinicians, and every member who's had the courage to ask for help and to support their colleagues. That said, I want to be clear that while peer support has tremendous value, it cannot be the entirety of our mental health strategy, nor do I believe that it's sustainable as a primary response to psychological injury. I'm reminded of my years as a lifeguard, where we were taught if a weak swimmer attempts to rescue a non-swimmer, you can end up with a double drowning. The lesson wasn't that people shouldn't help one another. The lesson is that good intentions are not enough, and the rescuer also needs training, support, and equipment and backup. In many ways, the same principle applies here. Peer supporters carry their own operational stress, their own trauma, and their own life challenges. We have to be careful not to place the responsibility for treating psychological injuries primarily on colleagues who may themselves be struggling. Peer support should be a gateway, not a destination. It should be one component of a comprehensive system that includes timely access across qualified mental health professionals, ongoing follow-up, organizational supports, and a culture where seeking help is seen as a sign of strength rather than weakness. Our paramedics take care of us on some of our worst days of our lives, and we have a responsibility to ensure that we're taking care of them as well. I'm encouraged by what I saw in this report, but I also think that it's an area that we can never become complacent. The work is ongoing, and the stakes are simply too high. So thank you for that work. A couple of questions. Can staff provide an overview of the mental health supports currently available to members and how those supports have evolved over the past year?
Thank you, Chair. With respect to the councillor inquiry, our well-being slide, we recognize that culture is an important piece of the whole scenario as well. That we've hired 3 clinicians, and those were identified in the investment strategy because we recognized in 2022 how profound the issue was for our service, and that we continue to support our peer support program. With the introduction of the 3 health clinicians, we've also looked at developing a more substantive health strategy or a well-being strategy. And as the councillor mentioned, that peer support is a gateway, not a solution. We're continuing to evolve our program to recognize that peer support is a gateway, is an entrance point, and that our mental health clinicians are part of a broader strategy to take care of the well-being of our staff. Our psychologist has been working with the fire psychologist as well. And also with the Ottawa Police Service as we look at different strategies to continue to support our staff. So it isn't strictly about the mental health in the, I'd say, the conventional sense. We're also investigating nutrition, the physical well-being in terms of physical fitness within the service, and coming back to culture again, recognizing how important all of these elements are within the service. And on the topic list that we're working on today is also, we've been in conversation with the Edmonton Police Service, who have had a reintegration strategy where staff who have been off for a certain period of time, there's an actual strategy on how to bring them back into the workplace in a safe manner so that they don't, so that they're comfortable and that they feel safe back in the workplace. So coming back to the original councillor's inquiry, I think that we've got a strategy. We're continuing to develop it. It's not done by any means. We're going to continue to kind of fulfill and look at other modalities to continue to support staff. And with the primary recognition that I think the councillor started with, that this is a difficult job. It takes its toll on individuals, and it's incumbent upon us all the way through to leadership to take care of staff and figure ways of taking care of their staff so that they can have a healthy life and a healthy career with the Ottawa Paramedic Service. Thank you, Chair.
Chief, over the course of the last year, have we seen increased utilization of mental health services? And if so, do we view that as a positive indicator that stigma around seeking help is continuing to decrease?
Chair, our belief is that stigma is decreasing. I don't have the data on the usage, but what I can tell you is that we're starting to make an improvement on our WSIB in terms of the plateau of starting to reduce the incidence of that. We still have a lot of work to do, Councillor and Chair. Our work is not done by any means. We haven't talked about violence, but violence against paramedics is also part of this story. So we have separate strategies to work on that. We have a committee taking a look at that. We're working with Ottawa Police as well in terms of recognizing where there's criminality. So it's all part of a bigger picture. It's not just one item that we continue to work on. Thank you, Chair.
If the chair would allow, if it's possible, at some point in time over the course of the summer, if we could be provided with the utilization rates of mental health services, that would be helpful, I think. Do we have proactive measures in place now to identify members who may be struggling before they reach a crisis point?
Chair, we're looking at some of those items. Right now, we have, the peer support program that's in place. We also have access to the psychologists, and our psychologists are working as a team, as I mentioned earlier, with fire and police to recognize the confidentiality, the stigma issues there. And coming back to your first question, we will come back with data with respect to utilization.
Thanks, Chief. Are supervisors trained to recognize the signs of operational stress injuries like PTSD, burnout, depression, and other mental health challenges among their teams?
Through Chair, if you're referring to specific programs like the ASSIST program, we're currently investigating that. We do have specific training for superintendents, but maybe not specifically to the items that you're making reference to. But overall, in terms of checking in with staff, to staying current with staff, to having those conversations with staff, to offering services, we do have those processes in place.
Are there any barriers to accessing professional psychological care, like wait times or availability of a clinician, or challenges finding practitioners with expertise in first responder trauma?
Chair, very good point. Yes, there are. Part of let's say, our investment plan in 2022 and the hiring of 3 mental health clinicians was an appreciation that the current city employee family and assistance program was not well received for staff. And there's many reasons why the employee assistance programs were not well accepted by staff. So that was part of the initiative for us to develop a more holistic program. So we continue to work on that. And in terms of access, that is an issue. We continue to look at new strategies and new opportunities. We're in discussion with the Royal Ottawa to gain access to their clinics for those individuals who may be more in a crisis situation. But the comment with respect to access is valid in terms of our community and the timeliness of that, because it is a travesty when somebody who's asking for help has to wait weeks or months for access to care.
I appreciate you mentioning families. I think that making sure that resources are available to spouses, partners, and families is important. You know, recognizing that the effects of trauma often extend beyond the workplace and into the home. Looking ahead, where does leadership see the greatest opportunity to strengthen mental health supports for paramedics? And are there areas that council should be considering additional investment for, or advocacy?
Chair, that's a tough one. I think my earlier comment that our job is absolutely not done. I think we need time to kind of fill out some of our programs internally to see where the opportunities are going forward. You mentioned families. That's an important element. We're engaged with Garnet families in terms of some research and studies to support families. I mentioned earlier the reintegration program that we're looking at. We started in concert with Fire, a program which was emotional skills resilience training for all new staff. So that's another program. And there's another program that's been developed through the RCMP that is getting traction across the country called mental health monitoring that we're also investigating as well. So I'd like to have some time to further investigate the programs, and I'm willing to come back to committee and council with a report on where we're at and some of the initiatives that we're willing to undertake and the support that we may or may not need from committee and council.
I do want to recognize the chair's indulgence here. This is my last question, and I'll turn it over to my colleagues. I care very deeply about this. If there's one thing that council should understand about the mental health challenges facing paramedics today that isn't fully captured in this report, what would it be?
I was struggling for an answer for you, Councillor. If I can take that offline, I can absolutely come back to you and through the chair to provide a more fulsome answer or a more cognitive or cogent answer to your inquiry.
Thank you very much. I appreciate your answers today.
Thank you, Councillor. Councillor Skalski, you're next, then Deroche.
Thank you, Chair. And thank you to the Ottawa Paramedic Service for all the work that you do supporting the health and well-being of our residents, and congratulations on this great report today. I have a couple of questions related to the rural service. The report notes that in early 2025, OPS dedicated 3 paramedic response units to Kinburn, Richmond, and Metcalfe, responding almost exclusively to high priority rural calls. Can you please speak to what you've seen so far from those dedicated rural PRUs and what's working well, and what early lessons are emerging for rural Ottawa, or essentially where do we go from here?
Thank you very much. And through the chair, those vehicles are assigned by our communication center to assign to high acuity calls, reducing the response time. They're also self-selecting lower acuity calls when they're not assigned on high acuity activity. So calls that normally may have sat in the queue for a period of time, we're now seeing a more prompt response on and whether or not they require transport. Those units are key because they can go to calls relatively quickly and cancel transport units when they're not required, helping keep availability for other emergency calls that come up within the community. Across the board, we've seen an improvement in rural response times across all CTAS levels over the last 2 years, and specifically since instituting the pilot with those rural paramedic units. So we're continuing to evaluate the data to look at if there's other opportunities to enhance on a go forward.
That's great. I mean, it's great news to hear that response times are improving in rural. My second question kind of taps into a little bit of that. You explained that rural response times have improved, both for CTAS 1 and 2, but rural performance still remains below the standards. Can you explain what are the main factors behind the gap?
Thank you very much. And Mr. Chair, I think as committee and council are aware, the geography of the city of Ottawa is extremely vast. With the vast majority of the population concentrated inside the Greenbelt, we are trying to strike a balance between call demand and the geographic coverage of those areas. With the population so spread out through the rural communities, it poses its own unique set of challenges to meeting the demand that's created from those service areas. Again, I think the single response paramedic units, was the first line strategy in looking at how do we improve response times for rural communities, and maybe the addition of another one on a go forward would help further mitigate some of the response challenges.
Oh, that's great. I think doing more of what's working is certainly heading us in the right direction. So that's good to hear. My last question is around the community paramedicine component. The report says that community paramedicine cared for more than 12,000 patients and provided more than 20,000 patient visits in 2025. So given the distance and access to care challenges in rural communities, can you just elaborate on how much of this work is reaching rural residents?
So our program does service patients all across the city of Ottawa, including rural residents. I don't have those statistics here with me today in terms of being able to provide you the number of rural residents that we provide care to. But we, in the West End, in the West Carleton Family Health Team, we do have paramedics that work out of the clinic in the West End. So there is a component in the West End of Ottawa that is receiving care in the rural community.
Great. Thank you. Thank you all. And congratulations again on this report.
Thank you, Councillor. Councillor Desroches and then Kavanagh.
Thank you, Mr. Chairman. Thank you for the presentation. And I would add the comments that the improvements we've seen over the term of this council have been truly impressive and important and impactful. Those statistics are really cold data if you don't need the service. But when you need the service, those quick responses are critical. Earlier this year, I thanked you, Chief, and your team for the response to my family when my son was hit in a hockey game. And that affected not just my family, but a lot of people who witnessed that. And of course, the expectation was that the ambulance and paramedics would be there in a timely fashion, and they were. So my family is very grateful. And it's not until you need the service that you realize how important the work you've done over the last 4 years is important and critical for families like mine and right across the city of Ottawa. I like to see the presence in the community in the sense of not responding to emergencies, but you have the vehicles that are waiting for calls that you assign kind of as a preliminary advance service. Sometimes they're tucked away in not visible locations, and I'd like to see them more visible. I think that the safety net of the city is the police, the paramedics, the fire department, the bylaw services, the OPP, the RCMP, and I consistently hear from residents that they want to see presence, right? And so I'm hoping that you would take the approach with those vehicles when they're not in service and they're waiting, that they be present and in places where people would see them. And I just don't want you to think that it doesn't matter. I think it matters when people see it. So I'm interested in your comment on that in terms of when those vehicles are on standby, if you will, that they can be more present rather than tucked away.
Chair, currently the system as it's been designed does have individuals who are paramedic resources that are in the community. And we're always trying to strike the balance between being on a street corner and physically being inside a bricks and mortar facility. Over the last 20 years or so, we have built some bricks and mortar which are on the street front which has been a good in terms of finding that balance in terms of presence. We do have some facilities where the paramedic and their site is tucked away, and I use Bexley as a good location for us to be situated, but not a good in terms of us presence to the community. We're still investigating other sites and to build bricks and mortar on the street corner where it does kind of have that balance, because what is in many respects, I'd say, not good for staff, and we have a lot of empathy, is that at Carling Woodruff, they're on a street corner. Their response time is fantastic, but it's no fun sitting in the front cab of a diesel engine that's idling for 2 hours at a time, or even an hour at a time. So we're always trying to strike that balance as we continue to look at building out as part of the long-range financial plan and physical sites that we have. So I'm not sure if I directly answered the question, Chair.
Yeah, I had more in mind the vehicles that, like I said, are those first responses. And my impression is that when they're not in service, thankfully, they're waiting for a call, they'll pick kind of parking lots or behind a mall or something. I just think it could be a little bit more visible, and maybe you don't want someone coming knocking up on the window saying something, but presence is important. That's my point in the community. And I just don't think we should take it lightly, and appreciate they're doing a report or they're getting ready, but I'd just like to see them not hidden.
Chair, appreciated. And as part of customer service, the paramedics that are situated in the market in Lower Town, that is part of their mandate, is to be part of the community as community representatives and as service representatives. They're often actually outside the vehicle and on foot. And we'll continue to expand that kind of programming. As part of being a public servant, it is quite appropriate for somebody to knock on the window and say, "Can you help me?" And we advocate for that service and that service level. In the rural areas, as we continue to expand, we're continuing to improve our presence in the communities. And those individuals have the same kind of mandate that Deputy Chief Furlong spoke about in the rural communities, that they have that flexibility to be in the community and not tucked away. So we continue to encourage that. Thank you, Chair.
Thank you, Chief. Last question is on training facility, shared infrastructure. The Ottawa Police is looking at a facility. We've, as a police services board, asked them to go back and to refine their requests and redefine the requests for this facility. There's, I think, a valid expectation that there would be exploration of a shared emergency services training facility. I asked the chief of the fire department the same question. And I'm not suggesting that it's a one-size-fit-all kind of facility, but that there'd at least be some effort to collaborate and share, for example, classrooms that might have a common purpose. And again, I think it's a good look, and I think it would be a real positive step forward when we show to the community that our emergency services not only work together when they respond to an incident, which you're very proud of, but behind the scenes, you're working to collaborate on training and using the same facility and trying to reduce the costs of this infrastructure, which is significant. So is this something you're looking at, that as part of this discussion on collaborative training, that you would consider working with the other branches of emergency services who you work with on a daily basis? Thank you.
Chair, currently our special teams work collaboratively with fire and police, and also with the National Police Service. So we're very much advocates for that. And we've been part of the discussion going back a number of years with the Ottawa Fire Service to look at a collaborative training facility. And we're willing to investigate and collaborate on that issue. Every day we're looking for space to maintain the competency and the training of our paramedics and our staff. We're regularly struggling to get Ben Franklin Place or Schenkman. So where there are facilities that can be shared, we're absolutely interested in those facilities and that kind of model of sharing resources and to better utilize resources. Thank you, Chair.
Thank you. I appreciate that answer. I'm not the first one that's raised it, and I'm looking forward to hearing more about how we can kind of streamline and collaborate behind the scenes, not just in the service response. Thank you.
Thank you, Councillor LaRoche. Councillor Kavanagh and then Vice Chair Hill.
Thank you very much, Chair. And thank you for your work that you do every day. Really, really, really appreciate it. But I wanted to especially focus on the wellness clinics, which have been a great big boost to our communities here in Bay Ward, particularly for older adults. And the one at like Carlingwood Library, the ones that you're having at the Ottawa Community Housing buildings have been amazing. And I really think that they are doing a huge service to the healthcare system. I just want to know if they're going to continue them. As you know, we've got many buildings in throughout Ottawa that are naturally occurring retirement communities, therefore very highly populated with older adults, and many of them lack primary care. They're struggling to find a doctor and they just can't. So this really helps. And I just want to ask if these services will be continued.
Thank you for the question, and through the chair. Yes, it is our absolute intent to continue to explore new opportunities to have wellness clinics in the city. We currently have 3 that we're supporting more in the West End. We are looking at expanding into the East End, and it's definitely on our work plan, and we intend to do more with the wellness clinics going forward.
That's great. I hear fantastic feedback, and it really, really does make a difference. And I believe that we're reducing the workload, your workload, ironically, for the emergency side, because you're dealing with issues before they become worse. I've heard testimonies of this from many community members, so I just wanted to give a shout out. And I have another question. It's related to the safe injection sites, which are obviously closing up. And you've talked about it in that you're focusing on, and you have funding for the Byward Market area, et cetera. But do you think this is going to be a big strain on the paramedic system?
Chair, the closure of the consumption treatment sites is a concern for our community. The premise that the Ottawa Paramedic Service has been working under for the last several years, and even before the closure of the sites, is that we don't believe anyone should die from an opioid overdose. So we've dedicated resources through, particularly first with the Byward Market and then with Centertown. We believe that our numbers, our responses, our calls for service will increase. We've done a quick analysis looking at last year to this year, and we've seen a small increase already in the first 5 months of 2026. We're concerned about this. We recognize that the Ottawa Public Health is the lead on this agency. We're part of the task force that's looking at strategies to mitigate and to support our community. And we're, once again, coming back to our premise, we don't want anybody to die. We have paramedics that are in the community. We're supporting the training of individuals in the community to support that, to further enhance the response in the community. It is a concern for us, but we'll do what is necessary to keep people alive.
Thank you, and I hope that you'll reflect that and let the province know if there is a significant workload, because it could, we don't want a crisis, that's for sure. And I think we're all concerned about it. Thank you.
Thank you, Councillor. Vice Chair Hill, and then Councillor Johnson.
Thank you, Chair. Thank you very much, Chief, and to your whole team for a report that I think is impressive. When we look at the reduction in the level zeros and the improved statistics on the offload delays. I think it's an indicator of identifying the right problem, identifying the core issues in that problem, and using a data-driven model to solve that problem. And so I applaud you on something that I think should be exported perhaps to some other elements of the city where we can learn from this process. So thank you for your hard work and leadership on this. My first question is specific to the South Ottawa Paramedic Facility, as you raised, and I spoke to this at council the other day because I know the importance of getting your folks in and out of that site and the importance of connecting that site to the highway, and the easiest way to do that is through McKenna-Casey Road once that's realigned. So I know General Manager mentioned that he would get back to me on that. Do you have any updates on the validation of McKenna-Casey realignment as a part of the supporting planning, transportation planning for your Ottawa South Paramedic Facility?
Chair, we've identified McKenna-Casey as an important element of our new facility. To put this in context, our current facility on Don Reed Drive is at the end of a cul-de-sac. And we've been working over the last 20 years to get a secondary egress point. We do not want to create the same point of failure in the new facility. So it absolutely is a priority for us. I can't speak for planning in terms of where they have the actual commitments in terms of the road realignments, but we have it on our work plan for this facility. I will continue to advocate as this being a priority for the facility, because to have 2 points of egress is incumbent upon us from an operational point of view.
Thank you very much. With regard to your annual report, can you just confirm for me that your hiring and staffing levels are where they're supposed to be? Do you have any gaps or shortages across any of the professions that you have within your service?
Chair, Committee and Council has been a fantastic partner. We followed through on the investment plan as we've been directed. I'd also like to recognize that the Ministry of Health has been very supportive in supporting the communication center and the staffing there. So when you look at that number of 141, I think 105, 106 or so were through the benevolence of Committee and Council. 35 of those staff have come through the Ministry of Health in support of the communication center. So we continue to staff up. This is the last year of the investment plan. We have 23 FTE, new FTE that we're currently hiring, and we're filling that out this year. We've already seen positive in terms of our staffing level and our performance. And these are all kind of small data sets. But I will be conferring with the general manager on a go-forward basis to look at where we may need support, but that is to come as we continue to do our own homework before we come back to committee or council.
Thank you. You referred a bit peripherally to the issue of abuse and safety of your members. Do you note a trend line there? I know it happens, and one incident is one incident too many, but broadly speaking, year over year, is this going in the wrong direction? Is there anything that you need in order to ensure that your paramedics are safe?
Chair, this has been a difficult topic because I think it's in the last several years, we've actually shone the light on something that has been horrendous from a community perspective, that it's something that can't be tolerated. And for far too long that we've accepted this, and I'm going to put it in quotation marks, that it's part of the job when it truly is not part of the job. We see, and I think through the Auditor General's report last fall, that this is a problem, and that, you know, when we, and my apologies, I don't have exact numbers, but well over 100 incidents last year, this is a problem. So with the support of the AGs and their recommendations, we've highlighted that as a priority within the service. We have a committee that's working on it to actually record and codify so that we can make good decisions on a go-forward basis. we've been taking a look at other communities and the programs that they have. You know, at the far back end, we have this issue of changes to the criminal code and criminality and looking at aggravated assault as part of the changes to the criminal code. But we are going back to look at what can we do to support staff at an earlier process. So there's still lots of work to do for us. It absolutely is a problem, and we'll continue we can report back to committee and council on this. Thank you.
So appreciating that there's a consideration for changing legislation, and I respect that we can go through that process. Is there adequate enforcement of existing legislation on this issue?
Chair, part of the Auditor General's report recognized that we should work better together with the Ottawa Police. And Deputy Chief Furlong has taken that on as a priority. And we have had discussions with police. And in 2026, the police have been, and my apologies for not saying it the best way, have been much more supportive in terms of the laying of charges. It's a good and bad scenario to say that, oh, there's more charges now, but it's appropriate that we support our staff and that we start to define the inappropriate behavior with the support of the criminal justice system to say that this is unacceptable in our community. So the Ottawa Police have been a supportive partner here and will continue to ask for their support on a go-forward basis.
Thank you. Thank you for those responses. I think there probably is a place where specific data reporting to this committee would be a value add. I don't know exactly how to phrase that right now, but I think perhaps if offline, we could have a conversation about that in advance of the next committee meeting and see if perhaps there's a regular data update on this topic in order to make sure that we're giving you the support you need on this.
Understood, Chair.
My last question, how frequently does our municipality support neighboring municipalities from a level 0 perspective? I know that was quite a discussion we had a few years ago where we had Renfrew and others that were coming to support Ottawa operations because we were at level 0. Does that happen frequently in the inverse?
Chair, several years ago when we were, I'll say, suffering level 0 events, rural municipalities were supporting the Ottawa geography, particularly in the rural areas, and I wouldn't say on rare occasions, even downtown. We've since mitigated that in many respects. So to put it in context, I think there were a net of over 4,000 events 3-4 years ago where Prescott Russell, Renfrew, Lanark, SDNG were coming into the City of Ottawa to provide service. Just hold that number to the side. Please understand that the provision of paramedic services in Ontario is based on a seamlessness model. We have a funding partner in terms of the Ministry of Health, and they require this seamlessness concept that if whatever is the closest resource, irrespective of municipal boundaries, they will respond. So when Councillor spoke earlier about our rural response, that's also to mitigate this intermunicipal effect. And several years ago, councillors, other municipalities were complaining to our mayor. And I think through MPDS, which was the changes in our dispatch system, that was step 1 in mitigating it. Step 2 has been that we've been actually providing an enhanced rural service ourselves because of all the other initiatives we've undertaken. And lastly, I can report that last year, there was probably around 1,000 net times where we provided or other communities provided service in Ottawa. That's not a bad thing. That is actually a good thing that it's when it was required and they were the closest resource to provide that service. So as we continue to build out our service, especially in the rural areas, that number will continue to decrease. But there's also, when I say net, that means that there were probably 400 or 500 times where we provided a service in a rural community outside, could be Russell, could be in Carleton Place, and that there were 1,400 times that they came into our community. So it's kind of this balance that we create. I support it in terms of the seamlessness of the service. I think it's important for our community that we have that service. And that as we continue to enhance our service in the rural area, that'll continue to diminish that number. Thank you, Chair.
Thank you, Chair.
There was certainly a time not too long ago where, as the chief just said through your line of questioning, that as paramedics from Renfrew or Leiden, Grenville or Prescott Russell were trying to leave the city after dropping off a patient at the Civic or General or Queensway Carleton, that before they got out of Ottawa, someone would have a cardiac arrest in Canada or Orleans. And as the chief said, the provincial dispatch model says the closest available vehicle will respond. And so there could be a day where those paramedics not from Ottawa were servicing Ottawa patients. And if I was a reeve or a city councillor of those areas, as they were, I would be screaming bloody murder because their resources were servicing our patients. So the fact that we've put significant investment, we've realized this has been an ongoing challenge. We have reduced level zeros significantly, and offloading delays means City of Ottawa paramedics treating City of Ottawa patients, and our regional services are serving their patients. But this had been a significant issue for too many years. So again, this is a good news story for everyone in Eastern Ontario. Councillor Johnson, perhaps the last word on this matter.
Yes, sir. Thank you. So thank you very much for the report and thank you for your service. I just wanted to check in on the mental well-being response team because obviously we saw funding cuts happen for that program, which was showing some effective results. And I think we're all quite inspired by the way that you've responded to various needs sort of outside of a traditional service model. And this was one of them. So can you sort of speak to exactly how that funding didn't materialize? And when you talk about respooling it for 2026, what are the adjustments that you're making and what could be the impact on service from that?
Thank you, Chair. I'll provide some historical context and Deputy Chief Alexander can provide the what we're doing just last week. We recognize that mental health was a significant burden within our community. We had quantified that there were over 9,000 calls a year, 25 a day had a mental health component. And we said to ourselves, we can do better. So the historical context is that we worked with the Ottawa Hospital and their mobile crisis team. We put a paramedic with a mobile crisis team worker from the Ottawa Hospital in a vehicle together, and we said, we're going to do this. We've been doing that for about 3 years. The research that we've done through the Ottawa Hospital has been fantastic in terms of its effectiveness, value to the community. Over the last 3 years, we've applied for numerous grants to support this activity. We knew the Ottawa Paramedic Service that we would do it within our envelope while we applied for other money. The Ottawa Hospital has always been advocating with us that they need money to continue the program. Late last fall, October, November, they gave us notice that they were discontinuing their support for the program with respect to a physical individual in the vehicle with our paramedic. At the end of March of this year, that program or their support was discontinued. We continue to believe in the program. So I'll turn it over to Jennifer just to explain where we're at on the program.
Thank you, Chief, and through the chair. Effectively, we took a look at a remodel and considering having to re-envision the program. So effective June 10th, we actually are back out in the community. We do have a single mental well-being response paramedic that is deploying in an emergency response vehicle, and they will be continuing to engage and do referrals through the Ottawa Hospital and the mobile crisis team to be able to support those individuals in the community. So we are back out there with the intent of continuing to innovate on this program and continue to advocate for funding.
Thanks for that good news. I don't doubt that you have the innovation and creativity to meet the moment, but I continue to be alarmed when cities are being asked to remodel or rationalize or whatever word you want to use to, do more with less. And we also have a report coming from Ottawa Public Health saying that the province is not showing up for funding on some of those pieces as well. Health is a provincial responsibility, and the city of Ottawa has a big heart, and the paramedic service has a big heart and very creative minds behind it. But we do need provincial support and provincial partners here. So I appreciate your response, but I do continue the appeal at the provincial level to be able to look at how we work with hospitals and our response services so that we can deliver the results that Canadians expect.
Thank you, Councillor, and thank you, colleagues, for excellent questions and kind words for our paramedic team. I'll just say, as a member of the Transit Commission, we hear about our operators who are assaulted on the job, and there is zero tolerance for that. And we certainly want our operators to report the matter, but also receive the service from OC Transpo, and where criminal charges are warranted, that the police be engaged. We unfortunately saw bylaw officers, high-profile case, being assaulted. Again, completely unacceptable. Again, where warranted, we expect charges to be laid, and the same for our paramedics, that it is not acceptable at any time, but definitely, again, where charges are warranted, certainly have the support of this committee. So again, to the entire team, thank you for the presentation today. Very much appreciate it. The recommendation before us is that the Emergency Preparedness and Protective Services Committee recommend council receive this report for information. Is this carried? Carried. Thank you. Thanks very much. We will transition now to item 5.2 on our agenda, the licensing bylaw review and reenactment. So staff will join us. And as staff are coming to the table and we're getting set up, I just want to provide an overview of the order or sequence of what's going to happen with this agenda item. So first, we will receive a staff presentation. We will then, prior to delegations, move motions. So our public delegates will be aware of the motions before they speak. There's one technical motion and then two other motions from colleagues, which will be read. And then we will receive public delegations, and then we will have questions for staff and debate on the matters. So staff presentation, then we'll read the motions on the record, and then public delegations. So who's going to start off? Mr. Gravel, do you want to introduce your team?
Thank you, Chair. But I would actually throw that over to Samantha.
Perfect. Welcome to you all. Good morning.
Thank you, Chair. The Public Policy Development Services team is here to present the results of the licensing bylaw review. This project has been a central part of this term's of Council's bylaw review work plan. Staff are recommending the repeal of the current bylaw and its replacement bylaw its replacement through the enactment of a new fully updated licensing bylaw. The recommended new bylaw ensures licensing regulations are modern, efficient, and effective, and supports Council's priority of a diverse and prosperous economy. We are not recommending any new licensing categories, and the only businesses currently required to obtain a license will be required to do so under the new bylaw. The bylaw largely carries forward what works, makes practical improvements where needed, and ensures that regulations remain clear, fair, and effective for both businesses and the public. It has been developed through consultation with internal city service areas, direct engagement with licensed businesses and associated business networks, as well as jurisdictional research and benchmarking. Next slide, please. The review presented today is one of the final reviews of the ambitious bylaw review work plan undertaken during this term of council. As you can see on the current slide, a number of reviews have been completed throughout the term of council, including a number of supporting reviews that have underlined this licensing bylaw, including the repeal of outdated towing regulations, a comprehensive review and enhancement of snowplow contractor licensing requirements, the introduction of licensing frameworks for vapor product retailers and hardscape contractors, and the review and modernization of licensing requirements for food premises. L'examen présenté aujourd'hui est l'aboutissement
The
d'un plan de
present
travail ambitieux
review
au sein
work
mandat du Conseil.
is the result of an ambitious work plan. What we've done, we've made many important strategic initiative and consultation. We want to repeal some of the obsolete towing regulations. We will review the permit of snowplow contractor and vaping product. We want also to put a framework for the vaping product retailers and hardscape contractors. We will also review the permit, the deliverance of a permit for food premises.
With me is David Kurz, the bylaw review specialist that has been leading this review. I want to thank him for the excellent and meticulous work that he has done, and to recognize the work of Joshua Davis and Ashley Cheslock on our team, who have been supporting David in his review. Now David will walk us through our recommendations. Next slide, please.
Thank you, Samantha, and good morning, Chair and members of committee. The city's licensing bylaw sets out the rules, requirements, and administrative processes for businesses that require a license to operate in the city. The city does not license all businesses. Council has used its powers under the Municipal Act to establish licensing requirements for different categories of business in the city. This is typically done to address issues related to public health and safety, consumer protection, protection of property, and community nuisances. Currently, there are 27 different business classes regulated through the bylaw. The current bylaw dates back to 2002 and was implemented as part of a harmonization of existing licensing rules from the former municipalities of the city. It is structured in two main parts. The first part contains definitions, general administrative rules and processes, including appeal processes and offenses and penalties. These apply to all businesses requiring a license. The second part of the bylaw contains the individual sets of regulations that apply to each specific type of business, which are appended to the bylaw as schedules. And currently there are 34 schedules under the bylaw. There's now been over 90 different amendments to the bylaw, and prior to this term, there had been no comprehensive review of the entire bylaw as a whole, which is why it was a project on this term's bylaw review work plan. Staff identified three key goals to help guide the review. One, to modernize the existing regulations to account for industry changes and emerging business models. Two, to identify and explore opportunities to reduce unnecessary administrative burdens for licensed businesses while still maintaining the proper regulatory checks and balances to meet council's objectives. And three, to identify and eliminate any duplication and inconsistencies within the bylaw that may have developed over time as various amendments and changes were made. The personnel
has three main goals for this review and reenactment. First of all, they wanted to modernize the actual regulations, and because the situation has evolved and the business model also. Then we wanted to identify opportunities to reduce unnecessary administrative burdens for companies while putting in place measures, verification measures. And then the third goal was to eliminate duplication and inconsistencies within the bylaws that could happen with every amendment.
Staff conducted extensive consultation and engagement for the comprehensive review of the licensing bylaw beginning in 2022 and 2023 with internal city departments and service areas, followed by two separate phases of external engagement with licensed businesses directly. First in 2024 with an online survey, and then again in 2025 to obtain feedback on policy changes under consideration. In 2026, staff undertook consultation with counselors and conducted further follow-up consultations and engagement with licensed businesses and business networks as needed in early 2026. Next slide, please. Before walking through the recommended updates and changes in more detail, here are a few key highlights of the recommended new bylaw. The recommended new licensing bylaw ensures licensing regulations are modern, efficient, and effective and support council's priority of a diversified and prosperous economy. Staff have reduced the total number of licensing schedules appended to the bylaw from 34 down to 28 through the harmonization and consolidation of multiple sets of regulations. The bylaw carries forward what's been working and makes practical updates where they were needed to help ensure compliance and remove unnecessary administrative burdens. There are no new FTEs required, no changes to existing license fees, and no new license categories being recommended. Next slide, please. As mentioned, there are 27 business classes regulated through the licensing bylaw. Staff's recommendations include key changes and improvements for the 5 business categories bolded in blue, while smaller and administrative amendments are being proposed for other business categories and the general provisions of the bylaw. Next slide, please. First, with respect to amusement places, staff are recommending that this license class be renamed from amusement places to entertainment establishments and places of assembly. To support this change, new terms and definitions are also recommended to provide clarity on which businesses and activities are covered by the license, and to also provide alignment with the city's new zoning bylaw. This includes terms such as nightclub, indoor entertainment facility, amusement park, and place of assembly. Staff are also recommending a new streamlined authorization process within the licensing regulations for entertainment establishments that would allow licensed venues to host all-night dance events without the need for a separate license for each event. This would provide increased flexibility and cost savings for venues and event promoters, as well as significantly reduce the administrative efforts for both business owners and city staff. This would result in a cost savings of approximately $400 per event and would provide benefits to the city's nightlife economy. Specific information, approvals, and the advance notification would still be required prior to hosting an event, and the chief license inspector would have authority to refuse an event from taking place or rescind the authorization if needed. Next slide, please. Secondly, for refreshment vendors, staff are recommending significant harmonization and consolidation of 5 separate sets of regulations into one universal license category for all refreshment vendors. As part of this harmonization, any unique rural regulations or exemptions would be maintained. Staff are also recommending changes that would provide increased operational flexibility for vendors, such as extending the current 6-month license option to 8 months at the same cost, which would help better reflect the seasonal nature of operations. Staff are also recommending a new 1-day license option for vending at special events, which would come at a cost savings of approximately $120 per event. Lastly, staff are recommending extending the hours of operation for vendors who operate on the street or sidewalk from 11 p.m. to 1 a.m. and allowing the use of generators at special events taking place on private property.
Now, for refreshment vendors, the personnel recommends the harmonization and consolidation of 5 sets of regulations, and this will be under one single category. For this harmonization and consolidation, there are existing rural-specific provisions and they will be maintained. The personnel also recommend some changes to update the seasonal license duration. It will go from 6 months to 8 months for exactly the same price. This takes into account the seasonal aspect of some events. The personnel suggest also a 1-day license for special events. This will allow savings of around $120 per event. Also, the personnel wants to update the hours of operation for street and sidewalk vendor all the way up to 1 o'clock in the morning from 11 p.m. and to adapt rules to allow generators at special events on private properties.
Next, for driving school operators and driving instructors, staff are recommending a new annual requirement for driving instructors to provide the city with an acceptable statement of driving record from the Ministry of Transportation in order to obtain and renew their annual license. These records help city staff ensure that licensed driving instructors do not have any active suspensions or convictions under the Highway Traffic Act and the Criminal Code. This will help enhance public health and safety as well as provide consumer protection. Records can be obtained instantly online at a cost of $12. Secondly, staff are recommending updates for driving instructor vehicle roof signs. Vehicles used for driving instruction are currently required to affix a roof sign that displays the name of the driving school on the front and back and that can be illuminated. Recommended updates include a requirement to ensure that the information displayed on the sign is in a clear and legible manner, and that signs must be illuminated 1/2 hour before sunset to 1/2 hour after sunrise while driving instruction is being provided. This is similar to what is currently required for taxis, limousines, and private transportation company vehicles under the city's vehicle for hire bylaw. Next slide, please. Next, for secondhand goods stores and pawn shops, staff are recommending new requirements to provide increased consumer protection, which includes annual proof of valid commercial general liability insurance in the amount of $2 million, as well as a new annual requirement for a criminal records check for any business that provides pawn transactions. Additional updates are recommended relating to license exemptions, ensuring that secondhand goods stores and pawn shops do not sell or offer for sale any items that are infested with pests or that are not compliant with applicable federal legislation, lowering the required number of pieces of ID to conduct a transaction from 2 to 1, ensuring that transaction records are properly maintained, removing an outdated requirement for all transaction records to be transcribed in ink, and allowing the use of alternate storage facilities. To help modernize the regulations and remove unnecessary administrative burdens for licensees, staff are also recommending that certain secondhand good items be exempt from the required 30-day hold period. This includes items such as books, magazines, certain appliances, clothing, furniture, and cookware, among others.
In order to modernize bylaws and reduce the administrative burden, personnel wants to exempt certain secondhand good items from the mandatory 30-day retention period. This will apply to books, magazines, appliances, clothing, furniture, and cutlery.
Finally, for body rub parlors, staff are recommending an updated definition to the term body rub to provide clarity as to the specific types of establishments meant to be regulated under this license class. It was identified during the review that the term body rub as currently defined could improperly capture holistic or alternative medicine practitioners or other personal service settings which would not be considered adult entertainment establishments and thus would not align with the intended scope of this regulatory regime. In addition, an updated list of approved body rub parlor locations is recommended to remove locations that are no longer operating. Next slide, please. Additional updates are also recommended across various other licensing categories to help achieve the goals of the review. There are recommended updates to insurance requirements to increase the minimum coverage amount from $1 million to $2 million, as well as updates regarding police background check requirements to align with current provincial and federal legislation. Updates are also recommended to ensure compliance with site plan requirements for certain business categories. Site plan compliance for these businesses has been a requirement under the site plan control bylaw since 2014. However, it has not been clearly set out in the licensing bylaw. Confirmation of site plan compliance and approval would only be needed when a new license application is made or when a new building is being constructed or an existing building is being repurposed. Updated definitions are recommended for categories such as public garages and rooming houses to provide clarity for business owners, better reflect various business operations, and align with the city's new zoning bylaw. Staff have also consolidated and harmonized regulations for businesses such as exhibitions and flea markets and itinerant sellers, and have also removed some regulations for exotic animal rescue and education establishments that were identified as redundant with current national accreditation standards. Updates to the licensing regime for rickshaws are also recommended to include large quadricycles, which are regulated under the city's new large quadricycle bylaw approved by City Council in April. Lastly, there are specific licensing areas where staff are not recommending any updates or changes. Next slide, please. Updates and changes are also recommended for the general provisions of the licensing bylaw, which apply to all licensed business classes. This includes new and updated modernized definitions for key terms throughout the bylaw, with an emphasis on providing alignment with the city's new zoning bylaw. Structural changes to help make the bylaw easier to read and understand, including consolidation and removal of duplicated regulations and requirements, and an updated system of fines that would provide increased fine amounts for daily or recurring offenses under the bylaw. Staff also note that the recommended new licensing bylaw will dovetail with the upcoming online business licensing solution currently being developed by staff in Bylaw and Regulatory Services. The solution is anticipated to be implemented in fall 2026 and would implement an online public-facing platform for licensing and permitting application and payment processes.
Le personnel a également fait remarquer que le nouveau règlement sur la
We
délivrance
want to
des
make sure
permis
that the
de
general
conduire sera
licensing
compatible
rules
avec la solution de permis
will be
d'entreprises en
compliant
ligne,
with the
personnel des
modernization
services des
with the new
règlements
online
municipaux
business
se prépare
licensing
avec
solution
Cette
in the fall
solution
2026.
devrait être mise
This
en œuvre
should
à
be
l'automne 2026
starting to be used
comme
in the fall
plateforme, une
2026.
plateforme en ligne accessible
It
aux
will be an online
facilitera
platform
la présentation des demandes de
that
permis
will
de
accept
licence
requests
ainsi que le traitement des paiements.
as well as payment. There will be also a payment system in it.
There are three key recommendations contained in the report before committee today. Recommendation 1 is a repeal of the current licensing bylaw and enactment of a new licensing bylaw with all recommended updates and changes. The proposed implementation date is January 1st of 2027. Recommendation 2 is a repeal of licensing bylaws for group homes that are still active from 3 former municipalities of Ottawa. Currently, there are 3 bylaws from the municipalities of Cumberland, Gloucester, and Nepean that set out a licensing requirement for group homes. Staff review concluded that a municipal licensing regime is no longer necessary for group homes as there are sufficient regulations and oversight mechanisms for group homes at the provincial level, and the city has existing enforcement tools available under other city bylaws to properly address issues when they do arise. Lastly, there are limits under the Municipal Act in terms of what the municipality can require from group homes as part of a licensing regime. This repeal would impact approximately 50 licensed group homes. Recommendation 3 is approving minor amendments to other city bylaws to ensure references to the current licensing bylaw are amended and replaced accordingly. Next slide, please. Staff recommend that the new bylaw take effect on January 1st, 2027. This would allow sufficient time for licensees to be informed of applicable updates and changes in order to ensure compliance when the bylaw comes into force. Progressive education and enforcement will take place throughout the year as annual licenses are renewed. Staff have communicated with licensees to advise them of the proposed changes and implementation date. Should the recommendations be approved by committee and council, further communications and information would be provided. Updated information and requirements would also be posted online on the city's webpage. Thank you.
All right, thank you very much to staff for the presentation this morning. You started off with a slide that indicated the ambitious work plan that council had approved at the beginning of this term, and certainly bylaw has been very busy this term of council. So we'd like to thank you. You're certainly ending with a significant review of these bylaws that you've just provided an overview on. So thank you very much for all the great work this term of council. Colleagues, as I said, we will now read into the record the 3 motions that are before us to ensure the public is aware of their existence as well. So we have a technical motion, which Councillor Hill will read into, and then he has another motion, and then I'll turn to Councillor Dudas, who will read one on behalf of Councillor Gower. So Councillor Vice Chair Hill, the technical amendment motion, please.
Thank you, Mr. Chair. Whereas Council is considering a repeal and replacement of bylaw 2002-189 with respect to the licensing and regulation of businesses, the licensing bylaw, and whereas staff are proposing some technical amendments to the draft bylaw in the report in order to clarify certain provisions of the draft bylaw before Council in response to feedback received from licensed businesses. Therefore, be it resolved that document 1 of staff report be amended as follows. Section 14(1)(d) of Schedule 5 be amended to read, quote, proof of special events liability coverage or commercial general liability coverage in the name of the licensee or event promoter subject to limits of not less than $2 million inclusive per occurrence for bodily injury, death, and damage to property that is valid for the date of the event. And Schedule 6, Section 6 of Schedule 9 be amended to read, no licensee shall sell, give, trade, or otherwise provide any exotic animal to any persons unless A, for the purpose of adoption or foster care under the auspices of the licensee, or B, to an accredited zoo or professional breeder for breeding and display purposes.
Thank you for that. So we'll deal with that once we have heard from our delegations. Next, you have a motion on places of worship and marriage ceremonies.
Thank you, Mr. Chair. Whereas the Emergency Preparedness and Protective Services is considering an update to licensing bylaw, which will formally codify the need of places of worship to obtain an entertainment establishment and place of assembly license for all non-religious activities. And whereas the licensing bylaw does not exempt the hosting of a wedding reception from the requirement to obtain an entertainment establishment and place of assembly license. And whereas churches, synagogues, mosques, and temples across Ottawa regularly hold weddings as a key element of their faith service. And whereas wedding receptions, called the Sudeh in the Jewish faith, a Walima in the Muslim faith, Viva Ka Swagat Samara in the Hindi faith, and the Doli in the Sikh faith are a key component of faith-based marriage ceremony. And whereas requiring places of worship to obtain an entertainment establishment and place of assembly license will incur additional costs for a core religious service that could otherwise be spent on the charitable functions of the place of worship. Therefore, be it resolved that the definition of places of assembly be amended to read, quote, but does not include a place of worship when used solely for religious purposes, including marriage ceremonies and wedding receptions and banquets, or a college, school, or university when used for educational purposes only. Mr. Chair.
Thank you, Vice Chair. And now Councillor Dudas on behalf of Councillor Gower. This is the licensing review, the fee reduction for one-day refreshment vendor and itinerant seller licenses. Councillor Dudas.
Thank you, Chair. Whereas Council is considering a repeal and replacement of bylaw 2002-189 with respect to the licensing and regulation of businesses, the licensing bylaw, and whereas the current licensing bylaw requires refreshment vendors to obtain a license to vend at special events, but charges the same license fee for events one day or less in duration as multiple day events. Whereas staff are proposing to create a 1 day or less license option for refreshment vendors at special events at a lower cost than the current license options. Whereas if adopted, the proposed license option would not come into force until January 1st, 2027. Whereas a large number of special events occur during the summer and fall, whereas Council wishes to support a diverse economy and vibrant livable communities. Therefore be resolved that the city reduce the license fee payable by refreshment vendors and itinerant sellers for a 1 day special event at a cost of $100 from July 15th, 2026 to December 31st, 2026 in order to maximize the cost savings for refreshment vendor businesses during their most active season.
Thank you very much, Councillor Dudas, and we'll get to that one as well in a few minutes. So are there any other motions at this time? Seeing none, okay. So just before delegations, I draw your attention, we also received 3 written submissions. They're in the shared drive for your review. So now delegates, I'll call on. We have 4 delegations this morning. The first, Terry Scanlon, followed by David Thompson. So if you are present, Terry Scanlon here, please join us at the table. I'll just mention to
Scanlon, I'm in the street vending business since 1983. And the reason I came here today was to speak to the Agenda 5.2, that is harmonization of 5 licenses into 1 universal license. I think that's a very positive move. It's very efficient, and it's going to help in processing licensing matters. Second, my concern is that staff has mentioned that unreasonable delays and burdens in the licensings that we have now. So I was going to submit that if vendors have the option of going online to renew their license, it would be very helpful. It would save a lot of time, give us a lot of flexibility, and would complement staff's desire to eliminate a lot of unnecessary burdens. Second concern I have is that hours of operation. Right now, we have to be off the streets at 11 o'clock at night. Staff suggests they'd like to change that to 1 o'clock in the morning. Well, due to our market research, we noticed that between 1 and 2 o'clock a.m. the following day, there's a tremendous amount of party goers. We'd like the opportunity to sell with those party goers rather than close down at 1 o'clock. So we're asking for another 60 minutes in order for us to participate in the business activities. Bearing in mind that the restaurants have same license that we have, except we pay more and they don't. So I'd like to take that into consideration. And that concludes my presentation today.
Thank you, sir. Just out of curiosity, did you operate your business outside L'Esplanade Laurier?
Yes.
Yes, I
Yeah.
recognize you.
I was going to mention the council too with the paramedic emergency services on the 202. Fortunately for the paramedics, I did have a cardiac arrest and they were there within 30 minutes because they were expecting the bikers to come in. So they were there and they gave me CPR and really they saved my life. So I thought I'd throw that in at the same time.
Great, thank you. Do we have questions for this delegate? There will likely be follow-up questions to our staff based on your delegation, so stay tuned. Thank you very much.
Okay, thank you.
Thank you, sir. David Thompson is next. Good morning, sir. You have up to 5 minutes.
All right. Good morning. Thank you for the opportunity to come and visit with you today. By way of introduction, I do have some municipal experience, 29 years in municipal government, first as a councillor, then as a county reeve, then a public school board trustee, and then finally the mayor of my hometown of Deep River. So I know a little bit about what it is to sit in your seat. I did want to talk about the bylaw, though. 27 categories. And you ask yourself, why? Why are some of these businesses licensed and others are not? We in Ottawa, we are overregulated. We have federal laws. We have provincial laws. We have municipal laws. Sometimes we have county laws. Here we have National Capital Commission laws. And all of them want a piece. All of them take a fee. And so I'm here today representing my son. His name is Nick. He runs a food truck. It's called Nicky T's. By the time Nick takes his food truck out of winter storage to the day he opens, he has to get the food truck safetied. He needs a TSSA inspection. He needs an ESA inspection. He needs a plumbing inspection. He needs a fire inspection. He needs a health unit inspection. And then we go down to pay for a license on top of all of those things. When I wrote a check a couple of years ago for $2,600, I kind of said, so what do I get? What municipal services do I get for this $2,600? And I swear to you, the answer was, well, sir, we use the money to hire bylaw officers to make sure you have a license. So I'll pause there for a second as you can let the absurdity of that statement sink in. It's crushing. It's, you know, $2,600 doesn't sound like much, but the total startup cost is $10,000 each and every year. Our profit margin is 8%. That is amazing. In the food and beverage industry, it's about double the average. But let me give you an example. Tulip Fest, we were there for 2 weeks. Next day starts at 7 a.m., ends at 11 p.m., 14 days in a row. And I can tell you this is tough, grueling, hot work. And this year, my son set a sales record at Tulip Fest, $79,100 in revenue. That's a lot of $10 poutines, I tell you. But after the 2 weeks, he asked to get paid, and me being the banker said, I can't. We haven't covered our startup costs for the season yet. You need to live off your tips. There's something wrong with that. When I'm asking you here today, look at those 27 categories, ask yourself, which ones can we take off? Which ones are already being regulated either by the province or by the federal government? We don't need this redundancy and we don't need that extra expense. It really adds up. I'm not a paid lobbyist to come here today. I'm just a dad trying to help out my son. Thank you.
Thank you, sir, for your delegation. I'll just Sorry, I had to click over here. Any questions? We don't have any questions yet, but again, you're welcome to stay and listen to the debate that's about to happen. Thank you, sir.
Thank you so much.
Thank you. Tina Maisonneuve and Dean Trichel, I believe, are providing a joint presentation. Are they online? Yes, okay.
Good morning. Good morning, Chair and committee members. My name is Tina Maisonneuve, and I am the CEO of CAZA. CAZA is Canada's accredited zoos and aquariums. And today I'm with Dean Trichel, who is CAZA's accredited manager of the national office. So CAZA will present today a verbal brief on CAZA and its standards. For the committee members' awareness, have a better knowledge and understanding of who CAZA is and the standards we bring to Ottawa. So I'm going to pass the mic over to my colleague Dean as he has a verbal presentation for you today.
Thanks, Tina. Good morning, Chair, members of the committee. I'm going to just give a brief overview of our accreditation process. And here's the challenge. Ottawa Section 3 requires facilities to prove animal care, entertainment, event safety, and rehab records through Section 86 permits. CAZA's accredited facilities already meet these requirements, and CAZA standards covers most of the areas that Protective Services oversees, things like governance, operations, and public safety. So just a brief overview, Canada's CAZA is a national authority. We've been around since 1975. And our role is to inspect and accredit zoological facilities across Canada. It is recognized globally. Canada's standards are benchmarked against the global programs. We are recognized by the World Association of Zoos and Aquariums as well. For our accreditation process, we have roughly over 330 different standards covering all areas of zoo operation. It's overseen by an accreditation commission. We look at everything from the documentation and the written programs. The accreditation process also involves a 3-day physical inspection of the facilities. Any CAZA association member must meet our standards, period. There's no latitude there at all. And the process involves an inspection every 5 years. And we go a step further than most zoological associations, where we require that the institutions do a self-evaluation annually. Our standards cover things like animal welfare programs, animal housing and environment, veterinary care, collection management, conservation, education and engagement, governance, physical facilities, and again, what's more applicable to these changes in your bylaws, the safety and security of the operation. We also have standards that are specific to elephants and marine mammals as well. Our commission is responsible for reviewing CAZA inspections, reviewing the annual attestations or annual self-assessments. The commission can grant authority to be part of the association, table it, or deny an institution's accreditation. We review existing standards and ensure currency and relevance. We also develop new standards based on industry best practices. Our commission is made up of a cross-section of zoo experts from large and small zoos, aquariums from across Canada. We also have an animal welfare scientist on board, and we also have a representative from the Canadian Veterinary Medical Association as part of the commission. So that gives you an overview of what CAZA provides, and I'm going to pass it back to Tina then for our recommendations.
So, Mr. Chairman and members, so today we're here to support the revised bylaws, but we're also wanting to work with the city. And if there's any other animal welfare, sorry, if there's thank you. So our recommendation is to work with the City of Ottawa. We want to look at adopting CAZA standards, would be amazing. CAZA standards for Canadian organizations. I think that's very important. Our federal and our provincial governments have been sharing all of this support local, support Canada. So we're here to do that. We are a national voice, and we're more than happy to present also a brief in writing at a future date if the chair or members of the committee wish to get a little bit more information about what we do and a deep dive into our standards. Thank you.
Thank you both very much. Very much appreciate your delegation today. I don't see any hands from my colleagues at this time, so thank you for your delegation. Delegation for Al Roberts has withdrawn, but we have added Laurier Trevor Deutsch. Good morning, sir.
Good morning.
You have up to 5 minutes. Please go ahead.
Good. Good morning, council members, and thank you again for the opportunity to address this committee. My name is Laurier Trevor Deutsch, and I did address the committee back in May when the initial changes to licensing bylaws were tabled. As a quick reminder, I'm president of Strathmere Associates International Limited and a consultant to several hospitality businesses in Ottawa, including Dream Mind Group, O'Brien's, The Brig, Waverly, several small establishments, and our own family cafe here in Ottawa. As such, I deal frequently with license-related and bylaw-related matters. When I spoke to this committee in May, I raised several issues related to the existing licensing programs and commented on the proposed changes. I read through the revised proposed changes in the bylaws, and I have to say on first review, I think we're there. And good on the city for its responsiveness and revamping of several of these antiquated regulations. The changes seem to address a lot of my concerns, which I had dealing with antiquated wording, duplication, unnecessary licensing and oversight, and my goodness, an online platform. That's huge. That's really, really terrific. However, I would like to do right now is simply pose some questions for clarification, because there's still some ambiguity in my mind, and ambiguity in licensing is only going to lead to problems going forward. The primary issue that I have is that the city has redefined the term amusement place to entertainment establishment and gives 6 examples of what's included. This includes amusement park, entertainment establishment to replace amusement place, indoor entertainment facility, nightclub, place of assembly to replace public hall, and theater. Great. So if I look at these examples, our family cafe and most of the places that I work with would not fit into any of these categories. I assume, for example, going back to my original point that I made in May, that if I'm going to have a guitar playing in my cafe for patrons that are eating, that this is not going to require an entertainment establishment license, and that everything would be covered by our food premises license and AGCO. However, when I dove deeper and looked at the specific definition of entertainment establishment, it states that an entertainment establishment is, quote, any premises or facility providing entertainment or amusement activities. And therein is a lack of clarity that I want to address, that there is no definition of entertainment or amusement. It looks very broad and open to interpretation. So I get back to my original question from May, which is, when does a venue cross the line from, say, a food establishment to an entertainment establishment? For example, DJs or recorded music in a restaurant or bar, a band in a restaurant, which becomes more of a bar with entertainment in the evening, a comedy club that serves meals during the show. I just don't know the answer to this. So for me, the question is, does the inclusion of entertainment, an entertainment component to the operation of a venue, require incremental regulatory oversight? If the answer is no, then everything should be covered under our food license, our AGCO, and our AGCO license. It should not be an additional licensing burden. I think this is what the city is proposing, but it's not clear to me, and I think the industry needs clarity. That's all I have to say. Thank you very much.
Good to see you back. Thank you for your delegation as well. I am sure a colleague will raise your exact question with staff. We are transitioning now, and I don't see any questions, so thank you, sir.
Thank you.
So colleagues, it's now in order to ask questions to staff of their report. You can also ask questions about the 3 motions before us. and offer your thoughts on what is being proposed. So I open the floor. Councillor Vice Chair Hill, go ahead, please.
Thank you, Mr. Chair. So our first delegate raised the issue of online renewals for subscription and permitting. And my question is, are we there yet? I thought we were going into that direction in terms of facilitating an online permitting, online subscription model. Is that happening? Is it in progress? And if it's not, why is it not?
Mr. Chair, great question, Councillor. And we are not currently there, but we are in the process, and the hope is for the fall of 2026 to have the online businessing solution in place.
So like in 6 months kind of thing?
That's correct.
Okay. And we also heard from our first delegate a question about essentially the addition of 60 minutes onto their food vendor timeline. Is that a major impediment, or would there be some upside? Or tell me the risk that goes with adding 60 minutes so that it's more aligned with the rest of the restaurant and entertainment industry.
Mr. Chair, really, Councillor, the risk is low, but there is some operational requirements that we may have to move some officers around so that they're on duty at 2 a.m. But really, the risk is low.
Okay, I will take a look at that with the intent of probably either providing a direction or a motion before the end of this debate on that topic. And I'll yield my time, Mr. Chair.
Thank you, Vice Chair. Councillor Johnson.
Thanks. So just a couple questions. So one is on the group home, rescinding the licenses for group homes at the municipal level. I guess I just want to know, I can understand logistically why we wouldn't want to duplicate that, but it is a form of housing. It is a form of, vulnerable people, identifying where vulnerable people may live. It might create additional pressures for public works or in emergency services. So I just wonder, are there risks or are there other ways that we're capturing our understanding of where these group homes might be? Is there a risk to losing a list through licensing regime?
Thank you, Chair, for the question. So in our review, we did not assess that there would be any risk to removing this licensing category. So under the Municipal Act, the city is limited in what we can actually request from group homes under a licensing requirement. It really simply is their address and a fee. We do have existing tools under other city bylaws if issues do arrive, such as the noise bylaw or the property standards bylaw. And for enforcement on that, I'll just turn over to Chief Gravel.
Through you, Mr. Chair. And Councillor, really, the tools that we currently have available to us would be the same that we would use in most residential settings as a group home. And we feel that removing the license would be appropriate in this situation.
Okay, very good. So otherwise, I guess my question is around, what kinds of consultations or feedback are we taking from professions that are involved in the licensing regime? We can see we've had some delegates with the hardscaping that have come back with some very, practical feedback that has then refined the license provisions. Again, here, a very diverse group of delegates, in areas like zoo standards or other things that I would be less familiar with. Is there a typical understanding that when you put out a license that affects someone's, livelihood like this, that there's a period of bedding in, let's say, where further refinements can come back to this committee? Is this something that you're building into your work plan as part of your understanding? Because I think it's something we've seen at least over the last 6 months happen quite regularly, and that's democracy. It's not a bad thing, but you're a very popular department. So should you be doing more on the front end, or is it typical that on the back end we're going to see this type of refinement?
So thank you, Chair, for the question. This is certainly something that is front of mind for our team, and we are certainly mindful of some of the things that we've seen in the last few months and the feedback we obtained used the example of hardscapers that were perhaps a little later in the process than we would have liked. And I think those are some ongoing conversations that we're currently looking at in terms of how we engage. I can say that we have reached out to all of our licensees in all of the categories, that David and the project team have done some really great work in meeting with professional associations and sending out updates. And in fact, CASA, who was here today, we've had 3 or 4 meetings with in the last year. So we've gotten really great participation from various professional associations as well. I do think one thing that we are looking at in the future is potentially posting our regulations themselves, the bylaw, a bit earlier in the process. I think a recurring theme that we're hearing is the devil is in the details. I don't know how many people are going to line up to read the bylaws in great detail, but what the hope is always that they will engage with them and provide that feedback. So we're always looking to engage with them more, but I can say that for this process, and David could perhaps speak in more detail to the consultation process, we've done quite a bit of consultation.
Okay. Oh, sorry, go ahead.
Yeah, I'll just add, Chair and Councillor, that we did strive to be very transparent in what we were looking to do under this review. We did have the added benefit of the existing licensing regulations being there for licensees to review, and then sort of weigh that against what we were proposing. So if there are other issues that come up, sort of when we get closer to actually bringing this to committee and council, we can certainly work with those interest holders to make any other practical amendments where we see that they're necessary before we go to council. But yeah, I'll just echo with Samantha that we are striving to do that, and we believe that we are transparent in our what we're considering under this review.
Okay, very good. I mean, certainly the delegation suggesting that, you're going to get your hot dog or your poutine between 1 and 2 instead of between 12 and 1 is probably an example we all can draw upon from some aspect of our lives. So, I would have anticipated something like that maybe coming forward a little earlier instead of happening at a delegation, but it's not I'm not mad at it. I do wonder that we're making sure that we're, doing our consultations as effectively as possible. So that's very good. And then finally, I know that we talked about this in some of our pre-briefings. You have the responsibility of trying to find the perfect word in your bylaws to try and help folks to understand what the implications of things might be. So here we have a delegate, similar to me, trying to understand, how you create a catch-all like amusement place and have an understanding of what it means. So is there a moment where a food establishment becomes an amusement place? Is there a tipping point that you can help us to understand where they may have to get another type of license? Or is the general understanding that food establishments are covered under the one?
Thank you, Chair. So this was actually part of the discussion that we had back in March. So there are a number of license holders who are food premises and amusement places. In fact, I believe that most of our amusement place license holders are also food premises. And so to the extent that a food premise is offering entertainment that falls within the definition of amusement place, they would be required to obtain an amusement place license. And that was, if you recall, because it's going a ways back now, but that was why in the scope of that food premises review, we merged the 2 licensing processes. So we made it possible to obtain both licenses through one application in the hope of streamlining some of those the requirements for inspections and things like that. So to help facilitate that process.
Thank you, Councillor. Councillor Skalski, then Deroche.
Thank you, Chair. I just wanted to take a moment to thank you actually for this great work and applaud you for, for the efforts to reduce red tape and administrative burden for businesses. We're obviously removing requirements that are no longer relevant anymore, and trying to put this all together was not a small feat. And thank you for answering all the questions that I've had before on various licenses that'll affect folks in our area. And just really, this is a great step in the right direction. So thank you. Yeah.
Excellent. Thank you. Councillor Desroches and then Kavanagh.
Thank you very much, Mr. Chairman. Thank you for the presentation you gave to me before the committee meeting. I'm very interested in the circular economy here in the city of Ottawa and believe it's important, not just for meeting our waste diversion priorities, but certainly appeals to a market of people who are looking to stretch their dollars and deal with the affordability crisis. So when we get into the thrift district, the thrift market, I worry about any kind of potential costs or barriers that we would put in place to enable them to function. There are some for-profit thrift, and I'm less concerned about that. I think they're able to manage. I understand that the charities are exempt from the bylaws, but we do actually have some smaller thrifts that are for profit. I have one in my ward called Reread Used Books that was just recently launched, and I hope that they can succeed. I know the bylaw would call for some a requirement that they have some liability insurance so that we wouldn't be sued for a situation that might happen in the store because some wily lawyer would look to try and spread the claim. I know you have looked a little closer at this, and you don't feel that this would be this new insurance requirement would present anything that would be seen as onerous to these smaller for-profit circular economy stores.
Thank you, Chair. We actually reached out to a number of smaller licensees that we have in the secondhand goods category, and it confirmed our understanding that we've established through the course of this review that $2 million of commercial general liability insurance is something that most businesses have in place, and in fact is less than is required for many commercial leases. So most of them already have this in place just from leasing their premises, and the business owners confirmed that this was not particularly onerous for them.
Thank you. I appreciate that outreach and that assurance today. What concerns me is when and I think we saw it with the landscapers, that when we have industries or groups that are represented, they engage well with the city. They engage well with elected officials, right? Subject to the lobbyist registry and what have you. But when we get into sectors where they're just not as organized, you really need to make sure that we've reached out and talked to people that wouldn't be following the day-to-day thrusts of what's going on at City Hall. So I appreciate that extra effort, and gives me some greater confidence that it won't be anything problematic. Hopefully. Thank you.
Thank you for that. Councillor Kavanagh, you're next.
Yeah, thank you, Chair. Thank you for all this work. I realize what a massive undertaking this is, just trying to weave it all together and clean it up. Much appreciated. I'm going to ask a question about pawn shops. And the reason is because I had a resident who had items stolen from their house, and they were very worried that they could go to a pawn shop and had no idea how it would be tracked. And this happened a few years ago, but it's still a question. And I see that you have information about, if there's some sort of suspicion that something may have been stolen, but I'm not sure how you define that. For example, how does that work for jewelry? Because in this case, it was jewelry. But, and I realize there's more than one way to sell things than pawn shops. But I just wanted to get an idea so I can understand what you mean by the reasonable cause to suspect it has been stolen.
Thank you, Chair, for the question. So yes, Councillor, there are some language in the regulations about notification to police and sort of what that would entail. So this may include either the removal or defacement of serial numbers, identification or model numbers on any secondhand good that's presented. So those are some specific examples, but I think overall it's simply a requirement to the licensee to notify police if there's any reason to suspect that an item that's brought in for exchange has been stolen.
Yeah, I suspect it's really hard with jewelry because it's hard to identify. You know, you're not going to scratch out a serial number on that. So, but I just wanted to get an idea because that has come up and not to pick on upon brokers because they actually are one aspect of reselling and there's so many ways to resell. So, but I just wanted to get an idea for that. Thank you.
Thank you, Councillor. I'll go back to Vice Chair Hill.
Yes, thank you, Mr. Chair. I wanted to refer back to, I think it was our fourth delegate who spoke to his concerns in interpreting the difference in the definition between an entertainment facility and a restaurant. And I think in this case, perhaps what would be appropriate is if it's possible for your interpretation of the response or the answer to that to perhaps be circulated in an industry letter or a memo or something, because my understanding is that you have a good appreciation for what those distinctions are. And those perhaps just need to be communicated. Is that a fair kind of way to roll that up?
That's certainly very feasible, and we can look at how to communicate that within the industry.
Okay, I appreciate that. And I think, Mr. Chair, if you're all right, I'd like to submit an additional motion with regard to the food vendor truck. I might just need a minute just to get it up. Okay, thank you, Mr. Chair, and thank you very much, Jerome. So this is an amending motion that the licensing bylaw be amended regarding food vendor hours of operation to add 1 hour for a closing time of 2 a.m. as aligned with other restaurants and entertainment establishments.
Okay, thank you for reading that on the record. So colleagues, I don't see any other hands. I guess we're prepared to vote. So we're going to take each matter in order. Sorry, just on the matter of the Hill motion, can staff just comment? This is extending the operating hours from 1 to 2 a.m.
Thank you, Mr. Chair, and we support the motion.
Okay, fair enough. Thank you. Okay, so there are 4 motions before us in addition to the main motion. So the first was the technical amendment motion. Is that matter carried? Okay, thank you. Then Vice Chair Hill had a motion regarding places of worship and marriage ceremonies. Is that matter carried?
Carried.
Thank you. And then Councillor Dudas on behalf of Councillor Gower had a motion with respect to reducing the fees. I don't have the motion in front of me, but looked reasonable. Thank you. And then the Vice Chair Hill motion on extending the hours from 1 a.m. to 2 a.m.
Carried.
Is that carried? Thank you. And then on the main motion before us as amended, that's the staff report. Is that matter carried?
Carried.
Thank you, colleagues, and thank you, staff. Great work. Mr. Scanlon, you can come to City Hall and impact change. You can get it done. Okay, our final item of substance today is the 911 annual report. And I'll invite staff to come to the table. Director Gooding, when you're ready, if you want to introduce your colleague, that would be great as well. Thank you. Good morning to you both.
Okay, thank you, Chair, Vice Chair, and members of committee. It's always a pleasure to be here. I'll provide a short presentation on the 2025 annual report for the 911 service. And joining me today is Mr. Eric Janis from the Ottawa Police Service. He manages the 911 comm center, and he'll be available to help answer any questions, especially any that may be operational in nature.
Today's presentation will be fairly short. I would like to give you a general overview of the volume of calls that we're receiving, what we receive in 2025. Then, I would like to explain what are our priorities for 2026.
So in 2025, there were just over 382,000 calls made to 911, which equates to about 1,000 to 1,100 calls a day. On average, 91% of those calls are answered within 6 seconds. And while that does not meet the city's current performance standard, it does exceed the industry benchmark used across much of North America and is considered strong. Call volumes have now declined slightly over the past 2 years, but the reality is that demand remains high, and Ottawa residents continue to rely heavily on the city's 911 service, as demonstrated this morning through some of the statistics shared by the Ottawa Paramedic Service. And one development I'm particularly pleased to highlight is the continual usage of our intercity call transfer function. So residents in Ottawa can request that their call be transferred to any 911 service across North America, and they do so approximately 85 times a month. And normally it's for wellness checks involving loved ones living elsewhere. Next slide. So it's very rare that children make calls to 911 in the city of Ottawa. And so when they do so successfully, we always want to celebrate them. In May, we held a ceremony to recognize 3 children who successfully called 911. In all 3 cases, it was related to medical emergencies. Their quick thinking and courage made a real difference, and it was a privilege to celebrate them. C'est toujours un plaisir de
It's
mettre
always
les
a pleasure to showcase what children have been able to do.
Ottawa Police Service and Ottawa Fire Services have now successfully migrated to the next generation 911 network. And over the past several years, including 2025, that work was supported by incremental funding from the province of Ontario. Next slide. So Next Generation 911 is a great success story for the city of Ottawa, with the migration occurring a full year ahead of the national deadline established by the Canadian Radio, Television and Telecommunications Commission. Residents won't notice any immediate changes to how they access 911, but this upgrade establishes the foundation for future capabilities such as real-time text messaging and enhanced location information. I do want to underline again that point, so that there's no confusion. Currently, the user experience remains unchanged. As new features become available, we'll ensure residents receive very clear information about what is changing, how to use those new features, and how they can benefit from them. But for now, the experience of calling 911 remains unchanged. Next slide. So this is the last slide, and I'll close by briefly speaking about the 911 service review. Committee has heard us discuss this work over the past couple of years. Vous vous demandez peut-être quels sont les résultats de
You
ce
may
projet.
want what's the result of this end project.
It has taken longer than originally anticipated because the emergence of Next Generation 911 required us to revisit some of our earlier assumptions. NG 911 is a fundamentally different operating environment with new governance, oversight, and technological requirements. We also want to make sure that we get this right. Ottawa has operated under the same service delivery model for over 30 years now. So any decision whether to maintain the current model or pursue a different approach needs to be made carefully and with a full understanding of the operational implications. So to support this work, we've established an internal working group comprising the emergency services, The group is reviewing the findings of the service review and assessing them against a range of criteria, including impacts on operations and service delivery. So with that, Chair, I'll thank everyone for your attention and hand things back to you.
Thank you very much for your presentation. Very much appreciated. Very much appreciated my visits, one recently, but over the term to the call center to see the calls in action and what happens. I'll look to my colleagues to see if we have any specific questions for you. Councillor Johnson, please go ahead.
Thank you. Can you just help me to understand what's being reported on page 5? So the police 911 call report says they're seeing a decrease in the calls year over year, but that they are having trouble meeting the service standard answer time. So that just, can you help me to understand why that would be? Because one would expect if they had fewer calls that they would be meeting their standards.
Thank you for the question, Mr. Chair. So it's a good opportunity to highlight that over the past several years, there has been a significant improvement in that service standard and the police's ability to meet it. I think a couple of years ago, if not maybe 3 or 4 years ago, they were reporting in the low 80% points, whereas now we're at 91% against the service standard. However, there are instances where our call takers can be overwhelmed, in particular when there's a very visible event, such as a motor vehicle accident or a fire, where there are multiple calls to 911 at once, and it can be a little bit difficult to get through. And in some cases, there are day-to-day staffing shortages that impact our ability to respond as quickly as we'd like to. I'll ask Eric to see if he wants to add anything to that answer.
No, I think the director has pretty much addressed all the issues. As we know, the service level objectives have been getting better over the last few years, and that's been essentially due to our increased hiring at the same time to be able to meet our requirements. So it's pretty much a straight correlation that level. There are definitely major events that's been mentioned, but when we look at the true cause behind it, it has been our race to be able to increase our staffing and do the hiring that we need to quickly enough, because in the operational world, it can take up to 1 year to train one person. So that's why there is definitely a lag, and that's why I think you've seen a lot of increases in our service delivery in the last few years as we were able to catch up to those numbers.
Okay, so if I'm understanding it correctly, it's not that the service standard on average is not being met, but there are spikes in calls around particular events that kind of interrupt the way that the data is presented, maybe in the best way. Okay, something to consider. Thank you.
Thank you, Councillor. Councillor Kavanagh.
Yeah, thank you very much. Just a quick question. One of the ongoing issues of people who live near the river is that their calls automatically get transferred to Gatineau because they're using their cell phone. And this can be a problem, especially if it's water rescue related issue or something very, very urgent. And I just wonder if there's been any changes or updates on that ongoing issue.
Thank you for the question, Mr. Chair. One of the major advantages of NextGen 911 is that the location of the calls will not be device-based. So that means it's not necessarily the closest tower. So next generation 911 will address those concerns, and the call will go to the appropriate service instead of being bounced from one city to the other just because of technology limitations.
Okay, so if it does go to Gatineau, it will automatically be transferred for, like, is there no, just want to make sure there's no lapse of time.
No, so in the current limitations that we've had protocols in place to be able to transfer 911 calls amongst each services, so it happens quickly. In the future, that bounce back will almost be eliminated because of the better technology, and we'll go to the correct service immediately and not causing any delays.
Okay, that's good to hear. Thank you so much.
Thank you, Councillor. Just the metric on total calls in 2023, that's the year where it spiked, and I just see clarification. I think there was a software issue with some cell phones. Can you just clarify that, please?
Thank you for the question, Mr. Chair. There was indeed a software glitch affecting all mobile devices across North America, which was creating erroneous calls to 911, not just in our jurisdiction, but everywhere. And so that contributed to the very high number that you saw that year.
Thank you for that clarification. Mr. Janis, if someone chronically calls 911 inappropriately for non-emergencies, how do you deal with those cases?
So in Ontario and Canada, there is no criminal act when it comes to making calls to 911. The only true option from a criminal code perspective essentially is for harassing calls. That being said, before anything gets to that level, there is significant amount of work that goes into a situation like this. Many cases in the past, these calls were due to mental health issues and not for somebody not having a hobby and trying to make calls to 911. So because of the nature of those types of calls, a lot of work is put in by many of their services to try to address those issues, to first of all determine why the person is doing it and if there's anything that can be done to help them. But ultimately, the answer to your question is there is a possibility of charging the person criminally for harassing phone calls, and that's been done in the past in some cases when it's been required.
Is there anything that you believe is a problem now in Ottawa? Are you seeing any type of, like, can you assign a police officer to make a visit and just talk about appropriate use of 911?
So if you look, and then that's a two-sided question, Chair, so thank you for the question. So there are intentional versus unintentional phone calls made to 911. So the intentional ones, if you were going to challenge me and say, give me a few examples in the last 10 years, I could barely come up with maybe 2 or 3. So it's not a significant issue from the malicious side of it. A challenge that we all have throughout the country is what is typically known as a butt call. So the calls that are unintentionally made to 911, those are definitely an issue. And I think it is something that, is on our radar as a city, as a 911 campaign going in the future as we look at the service level agreement. And work can always be done from that perspective, and engagement with the community is always welcome. But when we look at, as an issue, definitely it is a hog on resources, but nowhere close to be essentially being a crisis.
And if I could just add, Mr. Chair, that this is maybe a nice opportunity to compliment the residents of Ottawa, because Eric and I have had discussions with people in Peel Region, for example, or GTA, and they get a lot more calls to 911 that are inappropriate than we do. And so I think that it's a reflection of the appropriateness of the calls being made by our residents.
Fair enough. Thank you both. I don't see any other hands raised by my colleagues. So the motion before us reads that the Emergency Preparedness and Protective Services Committee recommend council receive the 2025 911 annual report for information. Is this matter received? Thank you very much. Thank you both. Item 6 is in camera. I'm not aware of any in camera items, but item 7, notices for which notice has been previously given. We do have a motion that was moved by Councillor Johnson on behalf of Councillor Kavanagh. That's regarding nuisance lighting impacts. We do have 2 speakers on this matter. So has the motion changed at all? Has it been revised? No? Okay. It has not. Okay. I received a printed copy, so I just wanted to verify. So we will go straight to delegations since you've already introduced the matter. And then if you wanted to speak to the item, I'll yield to you first, and then our colleagues. So Chaitna Misra, please come forward. Followed by Nicole Corrado. So all delegations have up to 5 minutes. Good morning to you. It's still morning. That's great. So please proceed.
Good morning, Chair and members of the committee. My name is Chaitna Mishra, and I'm an architectural lighting designer and founder of Lightbarn, an Ottawa-based practice focused on responsible lighting design, research, and public education on light pollution. I also serve on Royal Astronomical Society of Canada's Light Pollution Abatement Committee. I'm here today in support of this motion. Light pollution is not an inevitable byproduct of urban growth. In most cases, it is the result of lighting that is not appropriately designed, controlled, or contextualized. For reference, light pollution is generally understood in 3 primary forms: sky glow, which is the brightening of the night sky above our communities; glare, which refers to excessive brightness that reduces visual comfort; and light trespass, which occurs when light extends beyond its intended boundary and enters neighboring properties or indoor living spaces. While all three forms are relevant, many of the concerns raised by urban residents in Ottawa relate most directly to glare and light trespass. Through my work at Lightbarn, where we also deliver curated night sky experiences and public education programs, I regularly hear from residents experiencing these impacts firsthand. Common examples include floodlights from neighboring properties, decorative landscape lighting left on all night, and commercial or institutional lighting from parking areas or building facades entering bedrooms and their living spaces. As Ottawa continues to increase density through infill development and mixed-use zoning, these conflicts are likely to become more frequent. Buildings are closer together, sightlines are more direct, and lighting that was once isolated is now shared across property boundaries. Establishing clear standards now is a preventative measure that supports long-term livability and reduces future disputes. Ottawa also presents a specific local condition that intensifies these effects. For nearly half the year, snow cover significantly increases ground reflectance, amplifying the brightness of outdoor lighting. In winter conditions, even appropriately designed lighting can appear brighter and more pervasive. In most cases, nuisance lighting can be resolved through better design. For example, shielding fixture at the source, directing light downwards, selecting appropriate brightness levels, using timers or dimming controls, and applying motion-activated systems where continuous illumination is not necessary. It is important to recognize that while private outdoor lighting is a major source of light trespass in residential areas, public realm lighting, particularly in dense urban environments, can also influence overall quality of life when not carefully designed and managed. These impacts are not merely aesthetic or subjective. Research in human physiology has shown that exposure to artificial light at night can suppress melatonin production and disrupt circadian rhythms. And we all know that which regulates sleep and other biological processes. Light pollution also affects local ecosystems like bats, owls, and bird migration. Importantly, Ottawa is not starting from zero. The city's right-of-way lighting policy already recognizes concepts such as light trespass, glare, sky glow, and nuisance lighting. However, that framework applies primarily to the public realm and does not address lighting issue on private properties. This creates a clear policy gap that this motion seeks to address. Ottawa would not be alone in doing so. Municipalities as Mississauga, Mississippi Mills, and Richmond Hill have already implemented approaches to regulate nuisance lighting and light trespass. I would like to close with a reflection on Ottawa's unique history with lighting. In 1885, Ottawa became the first city in North America to illuminate all its streetlights with electricity. That moment reflected a willingness to lead in adopting new innovation and technology that reshaped urban life at that time. Today, Ottawa has an opportunity to demonstrate leadership again, not by increasing illumination, but by improving how illumination is applied. Thank you, Chair and members of the committee, for your attention and for advancing this motion. I support it and look forward to Ottawa continuing its leadership in thoughtful and sustainable lighting practices. I would be happy to answer any questions.
Thank you. Thank you for your delegation. We do have a colleague, Councillor Kavanagh, with a question.
Yeah, thank you, Chair. Just to thank you for coming out today and for your support of this motion. I will be asking questions to staff about this, and I appreciate you pointing out some of the main reasons why this is a good idea. Okay, thank you so much.
Thanks so much.
Thank you for your delegation. Thank you. I now call Nicole Corrado.
Okay. Yes, I'm calling in actually from Beaconsfield, Quebec, but one of the things I wanted to point out is that Ottawa, even if Ontario is reducing the protections on buildings having to be bird and wildlife friendly and lighting having to be bird and wildlife friendly, there are federal laws mandating that buildings, windows, and lighting has to be done in a way that it's not going to harm migratory birds, is not going to harm other wildlife, because there are other laws like the Migratory Bird Act and other, and the Species at Risk Act that will protect wildlife. And as Ottawa is trying to change its reputation and its attitude toward wildlife, I think it's best that Ottawa build it in a way that doesn't harm animals or birds with lighting and with glare, because it's considered a pollutant. The light's considered a pollutant. Glare on windows is considered a pollutant, and you're not allowed to pollute in a way that will harm. We're not allowed to pollute, but you can't harm other animals with it either. So I would strongly recommend that Ottawa works with the Fatal Light Awareness Program on light pollution management. So my question is, what is Ottawa doing to mitigate problems with bird collisions and windows, with light pollution, disrupting animals' sleep and confusing animals? What is Ottawa doing to mitigate light pollution and glare on windows?
Thank you. Does that conclude your delegation?
Yes.
Okay, thank you. I will, I see a colleague who has her hand up, so I'll yield to Councillor Kavanagh.
Yeah, thank you very much for your delegation. I really appreciate it. Just in the context of this motion, we're going to look at this, and I'm asking bylaw services to include this in their studies so that we can catch up with other cities, as has been mentioned. One aspect of it is how it affects nature, wildlife, et cetera, and birds. So I want to thank you for raising that. That will be raised in questions with our city staff, if that's okay. Okay. Thank you.
Thank you, Councillor. And I don't see any other hands, so thank you very much for your delegation this morning. We appreciate your time. Councillor Kavanagh, I said I'd yield to you if you want to have introduction to your motion.
Yep. Thank you very much. I appreciate this opportunity. First of all, I'd like to thank Councillor Johnson for moving this motion on my behalf. I really appreciate it. This came about because I've heard from residents and organizations about the effects of artificial light and how there really isn't any control over it. So if there's concerns, and they can be very devastating when you have light shined on you, that we have nothing in place to deal with it. So when we looked into it, we found that other municipalities do have these bylaws. Probably the most effective one is Vancouver. And a part of it is education. I think we can eliminate a lot of the problems just by letting people know the devastating effect that artificial light can have on public health and wildlife, and even just on energy conservation, and that it is possible to still have lighting. We're not talking about getting rid of lighting. We're just talking about redirecting it, really, and making sure that it's not just disturbing other people and just adding to light pollution. So that is the purpose of this bylaw. And I think it's pretty solid to see that there are ramifications, especially with intensification, where people are closer to each other. They might want to light up a little piece of their backyard and forget about how, or not realize that it can harm others if it's not directed properly. So hopefully there's a major education component to this bylaw, and to help contain light pollution. So I think my motion speaks for itself in all those aspects. So I'm prepared.
And when I saw this, I couldn't help but think of the Seinfeld episode where Kramer opened up his blinds and he had the big flashing red neon restaurant sign right outside of him. And the whole episode essentially, I think, was the story of this motion. But so I understand that one. That makes sense to me. The flip side to that is the old city in Nepean, where from a cost saving perspective, they didn't do streetlights. And so there were bylaws, in fact, for folks to keep lights on, and like the front yard pillar lights and such. So I just wanted to understand from a staff perspective, the lens being applied to this is looking at the Kramer extreme light version shining in someone's house, as opposed to looking at kind of making rural, or not rural, but the smaller, older suburban streets that currently don't have street lighting. Like, would it target that? Because I would have a concern if we're getting into making smaller local streets dark.
Chair, thank you for the question. So if this motion passes today, we would look to add it to the next term of council's bylaw review work plan. And that would be subject to the next term approving that work plan. Part of that exercise would be scoping out what would be included as part of that review. So I don't want to predetermine the outcome of that exercise at this stage.
Okay, so that would be my only concern, is that there are some streets that have street lights and there are some streets that don't. And there is a safety concern that goes with darkness. I would assume that there would be a line that would need to be drawn somewhere on the lumens that are given off by any light system, in much the same way that we have arguments about sound detection and, you know, how much is too loud on a road kind of thing. So I appreciate the intent behind this, because I wouldn't want to wake up to a red Chinese food sign in my bedroom window, but I would be concerned about the safety components of some of the local roads in the older suburban areas.
Thank you, Vice Chair. Councillor Desroches and then Johnson.
Thank you. How many light complaints do we get at the City of Ottawa presently? And what is that as a percentage of complaints?
Chair, we don't have that information for a committee today, but that is something that we would look at as part of this review if council asks us to include it in the next term's work plan.
Okay. No one's able to give me even an estimate in terms of what that would be, in terms of just a qualitative statement, in terms of, is it a lot? Is it?
Chair, I'll look over to our Chief of Bylaw and Regulatory Services to see if Jake might have a sense.
Thank you, Mr. Chair. I actually do not have a sense of numbers when it comes to some of our other calls in comparison, so I don't have that information in front of me.
Okay, well, that answer is telling in itself. That probably is not a top 10 question, certainly not one that I get. I'm not opposed to this. I think there's a lot of nuance in terms of what we're going to potentially do here, or the next term of council will do. In fact, I do hear from residents from time to time when there's unnecessary lights. So for example, if you're doing a site plan and there needs to be trucks and what have you in the back, and there's residents in the back, you do your best to minimize the impact of the lighting, but there will be lighting because there's our new retail plaza that's been there. So as we go through a lot of change in our cities, particularly with densification, I'm just concerned that we don't want to create barriers for enabling densification, for keeping the costs of housing low. But again, I think there's I'd be interested in where's the truly problematic lighting. And I've also heard from residents that, in fact, they would like more lighting. They would like our intersections lit more. Pedestrians would like to be seen in the evening. So I'm not sure it's universal that people want to see less lighting. I think there's situations where they would like to see more lighting. And when you travel through the Greenbelt, you go from an urban cross-section of lighting to a rural cross-section of lighting. That's a different experience for people. And I've heard that comment as well. So I will support it being tabled for the next term of council. But I would see, I'd need to understand better what we're trying to accomplish here and balance with the request for additional lighting in some places across the city. Thank you, Chair. That's all.
Thank you for that. Councillor Johnson.
Yeah, thank you very much. So until my husband starts wearing his glasses to drive the car, I think I would support more lighting everywhere at night. But with respect to housing, the conversations we've been having in our ward certainly have been around intensification and tall towers coming into established neighborhoods. And what I don't have is the right story to tell. I don't have a threshold by which to defend or
to defend housing or to defend resident interests. And in the absence of that, we end up in a position where it becomes very subjective. And so to offer some kind of sensitivity around it or some kind of, technical understanding of it as we welcome more neighbors, I think would be extremely helpful. Similarly, or differently to angular plane concerns that have changed over time. I think the expectation of lighting and different kinds of housing in neighborhoods has changed over time. But there currently is no clear understanding of what is appropriate and what isn't appropriate. So, for some it would be, whether it's at sort of neighborhood level. For others, they're concerned about party rooms that, stay illuminated at the top of a tall tower 24 hours a day, right? When do lights come on and off in congregate settings for the reasonable enjoyment of everyone else? And I don't know really what the typical answers for those types of distinctions are, but I think it's worthy of an exploration. And so as you try and, make everybody happy in the next term of council by just shoving it into that calendar, I'm really interested to see where this one lands, because I do want to be able to speak to a reasonable enjoyment for all neighbors as we have these changing built forms. So that's my interest in the motion. And I thank very much Councillor Kavanagh for bringing it forward so we can start to have these tools for discussion.
Thank you. I'm going to go to Councillor Menard next. Councillor Menard.
Thank you very much, Chair. I appreciate it. I'm taking in the committee. I'm not on the committee, but appreciate the motion here today from Councillor Kavanagh. It is certainly needed to take a look at next term of council and hopefully be part of that bylaw review work plan. The reason being on my end, I understand some of the comments about lighting from all councillors. I think the big issue is the advertising lighting that's shining in. It's certainly some of those towers where they've put up huge illuminated letters at the very top of them, and they shine into people either opposite towers or other homes on the ground or smaller mid-rise buildings. They're shining directly in a lot of examples, and it's for advertising purpose, obviously, of that building, but there's got to be reasonable thresholds about the times that those can stay on, how bright they are, and how much they intrude into neighbors' windows on a regular basis. Obviously, when it comes to street lighting, we've got provisions there, and that's important to keep the streets lit up and safe. But I think this is for me the larger discussion here is about the large advertising that's happening, and the emails that we get on a regular basis on some towers that have gone up that have put up huge block letters that are illuminated through the night, shining through all of neighbors' windows in that area where we get complaints. And of course, there's some other times when lighting goes through multi-residentials with businesses on the bottom, and you have to have some provision for how those lights may shine into neighboring apartments. So it's a balance, of course, but definitely we need something on the books here to get a little bit more teeth, given the issues I think we're seeing in our ward as intensification continues to come to the city of Ottawa. Thank you to the mover of the motion, Councillor Kavanagh, and thank you, Chair, for listening to these comments.
Thank you, Councillor Menard. Councillor Kavanagh, wrap up.
Yep, thank you. And thank you to everyone for their comments. I really appreciate it. Should be emphasized that this is not about turning off lights. In most cases, it's about redirecting them. One of the terms I learned from Vancouver is what's called full cutoff. And that is if you picture a light like this, and it's bright and it's shining everywhere, including the sky, it's, sorry for the hand movements, it's obviously not being used effectively. They have what they call full cutoff, which is basically like putting a lampshade on a light and redirecting it to where it's most useful. And that way it's not shining in people's eyes or anything, but it is being fully used. So those are the kinds of things, that's the education piece that can be done. And it's all there already in a city that's quite large. And this has been in effect for, I think, 7 years. So, and it's also about using warmer colors, for example, instead of something that's glaring. So it's not compromising safety whatsoever, but just being considerate. And I think that's possible. And I think that we have lots of room for it. But I see this as an issue that is going to grow. We've had calls, and the problem with bylaw is they won't have records because they don't have any bylaws to put forward if somebody has a complaint about lighting. So it kind of goes nowhere. So I'm not sure how they're going to record it. But that's what we've discovered, and that's why we came up with this direction. But I think there's lots of room for it, especially with the fact that intensification means that you're going to have more units living closely together, and we want good neighbors, and this is part of it. So I thank everyone for their interventions.
Thank you, Councillor, for moving this matter. Thank you, Councillor Johnson, for moving it on Councillor Kavanaugh's behalf. I'll just add, and I think Councillor DeRoche, to piggyback on your comments, the contradiction with this one is that my residents want more lighting and they want less lighting. With more lighting is obviously there are areas probably in common public areas where lighting can be improved. But where the less lighting is, to Councillor Kavanaugh's point, is to redirect the light more appropriately instead of the spillage or the what she calls in her motion the light pollution that exists. So I certainly do see this as an issue. And when the new LED street lamps came into effect, when Hydro Ottawa started to replace those antiquated light bulbs, we saw significant improvements in the intensity of that lighting in our public areas. But anyway, not to belabor this, I'll be supportive of this. And colleagues, the motion reads that staff include a light pollution bylaw or amendments to the property standards bylaw concerning light pollution and nuisance, and as an item for consideration as part of the development of a next term of council's bylaw review plan to be approved by council, and that other jurisdictions be considered as models as part of this work. So is that matter carried?
Carried.
Thank you so much. Notices of motion. Are there any notices? Seeing none. Any inquiries? Seeing none. There's no other business that I'm aware of. Before we adjourn, just a shout out to, I would like to recognize EPS staff in Event Central and all members of the Special Events Advisory Team who have been working hard to support another successful special event season for residents and visitors across Ottawa, especially the year of Ottawa 200. Last year, the SEAT team supported 239 events throughout Ottawa. In just the first 6 months of 2026, the team has already supported 211 events. Their collaborative efforts help ensure that these events are safe, well-coordinated, and successful, delivering important benefits to our residents, communities, and local economy. We are grateful for their service. Colleagues, I like you so much. We're going to meet again tomorrow. In a special joint meeting with our friends at Environment and Climate Change Committee. We will be meeting in council chambers, so not here, but we'll be meeting downstairs. The purpose of this meeting is to examine the Extreme Weather Preparedness Grant Pilot Program. So more on that tomorrow. Our next regular meeting of this committee is September 17th. Have a safe and enjoyable summer to everyone. Thank you. This meeting is now adjourned.